The future starts in 5, 4, 3, 2, 1.
Time for us to use technology for the good of humanity.
The future starts here.
7 aprile 2020, giornata mondiale della salute. Questa giornata si festeggia da 70 anni in tutto il mondo. Era il 1950. L'Organizzazione Mondiale della Sanità ha indetto questa giornata 2 anni prima, il 7 marzo, 7 aprile 1948, per la sua nascita. Quindi sono 70 anni che si festeggia. Il motivo per cui è stata indetta è quello di sensibilizzare la comunità internazionale ad un accesso equo alla sanità, a sistemi sanitari di qualità, un accesso equo per tutti. Ma è quello che abbiamo fatto? È quello che stiamo facendo? Stiamo utilizzando tutti i nostri strumenti innovativi, tecnologici e digitali affinché questo accada? È questo il futuro che vogliamo creare? Buongiorno a tutti.
Good afternoon, everybody.
Buongiorno Marco.
Good afternoon,
Buongiorno
Marco.
Cosmano,
Good
buongiorno
afternoon,
a tutti
Cosmano.
voi che siete in
Good afternoon,
ascolto.
everyone that is
Eccoci qua,
listening
come
to
andiamo?
the streaming
Allora, abbiamo
event.
fatto
How are you?
un'apertura
Well, we've been
diversa, no?
opening in a
Un'apertura
different way today.
insieme a te, insieme a
Together
Marco,
with you,
che è
together
un
with
pianista,
Marco, who's a
un
pianist
direttore d'orchestra,
and an
ha
orchestra
composto
conductor.
questo
He's
pezzo
been
10 anni fa,
arranging
che è
this
stato
Questo sì.
piece is
sei stato a
played in
Sanremo.
Moscow. You attended
ci hai suonato
Sanremo
da casa
and
perché
you played from home.
bisogna stare a casa in questo
Because we
periodo.
need to stay home
Purtroppo
now.
sì, speriamo
Yeah,
che ci liberino
unfortunately
presto,
that is the
perché
case,
sennò
but
dura,
hopefully we're going to
E
be
c'è un motivo
free again
particolare per cui
pretty
abbiamo
soon. But there's
fatto fare
a
questa apertura a te,
specific
poi
reason
entreremo
why I
nel vivo e
wanted you to
illustreremo
open this
a
event,
tutti e
and then we will
tutte le persone che
get
ci stanno
into
seguendo da
more
casa, ma che ci
details and
stanno
explain other
seguendo
people that
da
are
tutto il
following us from
mondo.
home, but in general from
Ricordiamo
all over
che
the world.
è tutto
Once
tradotto in
again,
lingua inglese e
everything will
disponibile
be
anche per le
translated into
persone che
English and
seguono
will be available for
dall'estero.
everybody
Però
who's
prima di
listening to
entrare
us from abroad.
nel vivo
But
dell'evento
before getting to
volevo passare la parola a te
the nitty-gritty
perché
of the
questa è una
event,
giornata
I wanted to give you the floor
importante,
because
no?
today
La
is
giornata
a very
mondiale
important
della
day.
salute. Stiamo vivendo un
World
periodo
Health Day and we're
ipercomplesso
experiencing an
Sì.
hyper-complex period
alcuni
of
temi
time.
sono diventati centrali,
And some topics
assolutamente
have become
questo
crucial.
problema, questo virus
For sure, we've got
Covid-19
the
che
COVID-19, which is
che
the
ha colpito
utmost problem,
tutto il mondo.
which
C'è
affected
tutto il
and
tema
impacted
delle
the
malattie
whole
che
world.
colpiscono
But we also
le vie
have the problem of
respiratorie.
all of the
Quindi
illnesses
tu te ne
and
sei occupato,
diseases
sono un po' di tempo
affecting
che ti
the
occupi non solo di
respiratory
musica ma di
system,
questo
and
tema.
therefore
Quindi
you are
a
doing
te
the
la parola
music,
se
not with this
illustri a chi ci
topic,
sta seguendo.
but for sure you
Vi
can
racconto.
help
Io
and can tell
praticamente un
something.
anno e mezzo
I'm
fa
going to tell you
ricevo una
something
mail da questa
because,
associazione
1.5
AMP,
years
si
ago I
chiama, è
received an
l'Associazione
email from
Morgani
the
Malattie
AMP
Polmonari.
Association, which is Lung
Ricevo questa mail,
Disease
non li
Association. I
conoscevo,
received an email
mi
from them. I
scrivono
didn't
una
know
mail,
them.
mi
They sent me
raccontano
an email and they
chi
told
erano,
me
che cosa fanno, di
about their
cosa si
association, what
occupano.
they do,
E
what
la
they deal
cosa
with, and
ovviamente mi ha
this
immediatamente
impressed me
interessato.
a
Quindi
lot
ci siamo
and
sentiti, siamo
awakened
andati a
a great
cena tutti
interest in me.
assieme,
We had a dinner
ci
together.
siamo chiesti che cosa possiamo fare per
And we asked
sensibilizzare
ourselves, what can
l'opinione
we do in
pubblica
order
su questo
to raise the
argomento, che adesso,
awareness
guarda caso,
of
è così
the
attuale.
people
Insomma.
on this
E
topic?
quindi
And
abbiamo
now, of
fatto questo
course,
primo
this
evento il
is very
settembre scorso
crucial.
qui
So
a
we
Forlì,
organized the
nella
first
piazza
event
Staffi, la piazza
in
principale
September
di
in
Forlì.
Forlì,
Abbiamo
in
fatto questo
the
mega evento
main
dove
square. We
abbiamo
organized a
arruolato
mega event
25
where
musicisti
we
sul
hired
web.
25,000
Abbiamo fatto
musicians in
anche
web,
questa cosa che
and
l'abbiamo chiamata un
we
minuto di
named
respiro.
this
Voi conoscete
a
benissimo la
minute
prassi di fare un minuto di
breathing.
silenzio quando si
Because
vuole
sometimes you have 1 minute
commemorare
silence
qualcosa, un
when you
brutto
want
evento,
to
la
celebrate
morte di
something,
qualcuno.
you want to
Invece noi questa volta volevamo semplicemente festeggiare il respiro,
to
perché il respiro
celebrate
è una
something, to
cosa
remember something.
importantissima di
And
cui
in this
non
case,
ci
we
rendiamo
wanted to
conto,
celebrate
non gli
breathing
diamo
because
peso.
you don't
E
realize
quindi abbiamo
you
fatto
are breathing a lot of time,
il
you
settembre
don't
scorso
attach
questo
much importance
minuto
to
di
it.
respiro,
But we
abbiamo fatto
wanted to
respirare
stress this
tutta la
fact, and
piazza per
therefore
un
wanted the
minuto
whole
a
square
tempo con una
to
base
breathe
musicale
1 minute
diretta.
long with a specific
Ed è stata una
rhythm
cosa
all
veramente
together.
molto
And it
carina,
was a
siamo stati
very,
primi a
very
farlo,
nice
io non l'ho mai
activity,
visto
very
fare un
nice event.
minuto di
It
respiro.
was a
Quindi andremo a
first for me.
ripetere
I've never seen
il
anybody
5 di
breathing
settembre
together for
prossimo
1 minute.
di
So
coronavirus
we're going
permettendo
to have this
ovviamente.
5
day for another
settembre
event on September
2020
Il
5th,
sarà
2020.
Esatto, io quindi invito tutti quelli
So
che ci
I invite
ascoltano ad
all
andare
of
sul sito
those who are listening
Sharing
to us
Breath,
to
in
visit the
inglese
website
il
Sharing
respiro
Breath,
condiviso, Sharing
www.sharingbreath.
e andare a vedere
This is the title
che
of the
cosa
website,
facciamo.
and
Tra
have a look at what
l'altro
we do.
il prossimo evento che andiamo a fare
The next event we're going to
faremo questo
organize
concorso anche per,
is also for
per autori musicali, quindi
a
autori del
contest
testo.
for
Quindi non c'è
musicians
limite di età,
and
chiunque si
authors.
può
So
iscrivere,
there's no
può
age
mandare un
limit.
testo,
You
un
can
testo che poi diventerà una
sign
canzone
in
che andremo
and
ad
you
eseguire
can send a
appunto il
text
5 di
which will
settembre.
become a song we
Quindi,
will play
tutti quelli che siete
in
in
September
ascolto, se
then.
siete dei
So
poeti
if
che
you
scrivete
are
testi per
poets or
canzoni,
you like writing song
andate
lyrics
sul
or
sito,
texts,
iscrivetevi e mandate
invitiamo
please
tutti sul
take
sito
part
per
in our event.
inviare
Visit our website.
le loro
You go to the
proposte.
website and send your proposal.
In bocca al lupo per
So good
questa
luck for this
altra
event.
grandissima
Very big
esperienza,
and
quindi
great
settembre
experience,
2020.
September 2020.
Grazie mille Marco,
Thank
grazie
you very much,
tante.
Marco.
Grazie a
Thanks
voi,
so
un
much.
bacio.
Thank you. See you.
Bene, buongiorno.
So
Buongiorno
good
a
afternoon
tutti.
once again.
Abbiamo voluto
Everybody.
aprire appunto con
We wanted
Marco,
to open
che ci ha
this
lietato con le sue
event
note
with
musicali.
Marco
La musica
with
è
his
da
wonderful
sempre
notes,
l'elemento che
because
va
music has
a
always
unire
been
tutto il mondo, tutti i popoli, tutte le persone.
Between
Questa è una fase
all of the
molto complessa,
people,
l'abbiamo
the
detto
world.
all'inizio.
It's a very complex
Noi volevamo
stage, a
mettere
very
in
complex period of
piedi
time, as we were saying
un
at the beginning, and we
evento come
wanted
questo,
to create an event like this,
particolare in questo
a very
contesto,
peculiar event in this very
sicuramente
context,
difficile,
which is a very difficult
per
context
mettere in
for
piedi
sure,
un'azione di
in order to
cooperazione
implement an
internazionale
international cooperation
innovativa e
action,
digitale.
in terms
Nel
of
senso
innovation
che nel
and
momento in
digital
cui è
technologies.
partito tutta l'emergenza
When
coronavirus,
the whole
in
COVID
primis in
emergency
Cina,
started, first and
abbiamo visto
foremost in China,
affrontare questo caso
we've
solamente in Cina.
witnessed
Successivamente è
different
arrivato in Italia,
approaches. First of
noi
all, the
italiani abbiamo
problem
iniziato ad
affected China
affrontarla da soli e
only,
così via.
and
Questo è
then us
accaduto nei
Italian,
singoli
we had
territori,
to
prima nei singoli
impact
stati,
and
e
to
ora
tackle
poco alla
the
volta
challenge
stiamo
individually,
vedendo
but then
come
we're seeing all the
ogni
other
singolo
countries
Stato
tackling this
abbia
challenge,
approcciato
and we are
questo
seeing
tema,
every
questo grosso
single
problema da solo, anche
country
sbagliando.
tackling this problem,
Noi siamo sempre
sometimes
stati
in a
convinti che
good
sarebbe
way,
stato
sometimes in
opportuno
a wrong
mettere in
way,
piedi
but we
un'azione di
thought it
cooperazione, di
was
coordinamento
important to start a cooperation and coordination
internazionale,
action at an
sfruttando anche
international
e
level
non solo
by
l'innovazione tecnologica e
exploiting
digitale. Allora
digital
abbiamo
and
pensato
technological
di fare
innovation, but not
questa
only.
chiamata
And therefore, we
internazionale
decided
unendo le
to go
forze,
for this
partendo
international
appunto
call for proposal,
dall'innovazione ma anche dai
joining our
cittadini,
efforts.
dalle organizzazioni no
So,
profit, dai maker, dagli start-up.
bottom,
Abbiamo visto
or
in Italia ma anche
grassroots
all'estero
level
come tutti si siano
proposals,
adoperati per
citizens
individuare
proposals
delle
in
soluzioni. Un
Italy as well.
movimento
We've seen how
internazionale,
people
globale che è
got together
partito
in
dal
order to make
basso.
proposals, and it was
Questa
a
è una
grassroots
forza
movement, and
intrinseca
this is a
nell'essere
very
umano.
intrinsic strength of
Probabilmente è
human
stata
beings.
sopita in tutti
Probably
questi
it
anni,
has
non
been
parlo degli ultimi 5
sleeping
anni, degli
over
ultimi
the
10
last
anni,
few
è stata
years,
sopita probabilmente
maybe not just the
nella
last
storia degli
5 or
ultimi
10 years,
100
but
anni.
I
Abbiamo
would
creato
say
dei modelli, dei
hundreds
sistemi
of years.
economici,
We've been
politici,
creating
sociali e anche
political,
legati
economic and
al
social
digitale, che è il tema
systems,
che trattiamo, che
digital
probabilmente
systems, which is
non
of
sono
course
così
a main topic
efficienti.
for us,
Lo stanno
which are
dimostrando
probably not so
questi giorni.
effective. And we
E
are
forse
witnessing
ripartendo
this nowadays.
insieme nel
Maybe if we
pensare a un
start
futuro
again together, if
diverso,
we think about a different future,
potremo mettere in piedi una
we'll be
società
able
effettivamente
to come up
differente.
with a different
Per anni abbiamo
society.
parlato
For
di
years
essere
we've been
non
talking
imprenditori di
about
se stessi, perché non porta a
not
nulla,
just
ma
being
essere
self-entrepreneurs,
imprenditori
but
della
being
società, mettere la
society
società al
entrepreneurs,
centro,
to put
neanche la
society in the
singola
middle,
persona.
not just
Questo
individuals.
probabilmente ci permetterà
And this
di costruire anche
will
modelli
enable us
economici
to
e
build
sociali diversi.
economic and social
C'è la
models
situazione
that can be
dell'emergenza,
different. There
ma
are
c'è anche la
emergencies, of course,
ricostruzione, il
but
fatto
there
di
is also
ripartire,
reconstruction,
dare
the
effettivamente uno
need
start
to
a un futuro diverso
restart
da quello
and to
attuale.
press the start button for a
Abbiamo
new
lanciato questa
future that can be better
call
than
per
the
Start the Future,
current one.
appunto rivolta
So
a
we
più
decided
soggetti e
to
rivolta
organize Start the
anche
Future,
a una
which
serie di
addresses several
global
subjects
challenge,
and
quindi
several
il tema
global challenges as well.
della medicina e della
So for
salute,
sure,
ma anche quello dell'educazione,
medicine
della
and
trasformazione
health,
digitale, dei cambiamenti
but also
climatici.
digital transformation,
A più
technological
soggetti,
transformation,
come dicevamo
climate change
prima.
and so on. And we've involved
Sono arrivate tantissime proposte,
different
oltre 1000 proposte da
subjects
tutto il
and
mondo.
several proposals
Abbiamo deciso
and
oggi
suggestions from all over the world came
di
in.
focalizzare
And we
l'attenzione
decided to
principalmente
focus
su
today
progetti innovativi
mainly on innovative
che riguardano
projects
la salute.
related with health.
Ci sarà anche una
And
visione,
healthcare.
vedremo maker
There
che sono
will
dati da fare, vedremo
also
anche
be
aziende,
a
avremo anche
vision
degli spunti
from makers. We will
legati
receive inputs
ad
and
altri challenge, quali ad
suggestions
esempio i
in
cambiamenti
terms of
climatici,
other
però
challenges, for instance, the
vedremo anche
climate
presentare,
change. But we would
oltre ai vari
like to
interventi,
present together with the
14
different
progetti
presentations
innovativi in ambito medtech.
14 medtech projects.
E voglio davvero ringraziare tutti
And
a
I
nome della,
really like
della
to
nostra
thank everybody on
realtà
behalf
per
of our
aver
association, of
risposto
our company,
in modo così
for
copioso. Quindi
replying
speriamo
to
davvero insieme
our
di fare
proposal, to our
un lavoro
request, and in such a
che
very
va
generous way. So
a impattare
we
positivamente
hope
nella
we
società,
will
così
have a
come
positive
ci
impact
raccontiamo
on
da
the
tempo, no?
society
Utilizziamo
as
l'innovazione
we
tecnologica e
are
digitale per migliorare la società. Lasciatemi
since
però ringraziare,
some
prima
time.
di,
So, but
di
first of all,
arrivare
I'd like to
con il primo
thank
ospite, le persone che hanno lavorato a questo evento in queste condizioni abbastanza complesse,
very difficult situation,
abbiamo e stiamo
very
rispettando
difficult
tutte quelle che
conditions.
sono
Of
le
course,
normative. Un
we are
ringraziamento
complying with all of the regulations
particolare
and
va
restrictions.
a Stravidio,
I'd like to thank
anche
Stravidio first of all,
al team di
the
Tre
video making
Civette
team,
e
the
a
Tre Civette team,
tutte le persone che da
and
tutto
all
il
of the
mondo, tutti i nostri
people from all
partner,
over the world,
che
all
dalla
of our
Cina, dalla
partners,
Spagna, dalla
ranging from
Bulgaria,
China
dalla
to
Romania,
Spain to
hanno
Bulgaria
inviato
and
i loro
Romania,
progetti e hanno fatto
sent
questa grossa
their
chiamata
projects
internazionale. Ma non voglio rubare
replied
troppo
to our
tempo,
couple
ho
of
già
proposals.
preso tanto.
So I don't want to
Diciamo che
take too much
questa
time.
giornata sarà
This day
abbastanza
will be a long
lunghina, ma
day,
ci divertiremo
not too long,
anche.
but
Come
we'll
al
have
solito avremo dei
fun for
momenti
sure.
di
We'll also have
intrattenimento,
some
termineremo
entertainment.
intorno alle 21,
We
21:30,
will
ci sarà un momento di pausa
we'll
intorno alle ore
conclude
18
at
di
around
10 minuti
9.
e ogni tanto ci
Or
saranno
9:30
degli
p.m.
intermezzi
we'll have
appunto
some
simpatici.
breaks that can
Arrivati
be
a questo
very
punto io
interesting for you
chiamerei
too. So
il primo ospite,
now I'd like to invite the
rigorosamente
first
collegato da
guest,
casa.
who's
Quindi sono
established
davvero
a connection
emozionato
from home,
di
of
essere qui,
course.
di avere qui in collegamento
I'm very glad
Paolo Zanzottera.
to
Ciao
welcome
Paolo.
Paolo Zanzottera.
Ciao
Hello,
Cosmano.
Paolo. Hello, Cosmano.
Buongiorno a tutte e a
Good
tutti.
morning,
Come
good
stai?
afternoon, everybody. How are you?
Dai,
Well,
in casa.
at
In
home.
casa, eh? Ricordiamo
At
che tu sei
home,
collegato
yeah.
da?
We
Brescia.
Repeat once again, you're from
Ebbene, sappiamo che anche quella è una
Brescia.
zona
You're establishing a
abbastanza che è
connection from
stata
Brescia,
colpita
and we know
in
that that
modo
city
importante.
was
Io ti ringrazio come sempre da
by
parte
the
di
infection in a very
tutti. Hai
strong
fatto
way.
un lavoro in
So
questo periodo
thank you very much. You've
encomiabile,
been
meraviglioso sui dati.
doing a very
I
good
dati sono degli
work.
elementi centrali, no? In questa
Data,
vicenda del
of course,
coronavirus
are very
abbiamo visto tutte le
important in
difficoltà
this
nel leggerli,
situation. We know that
nell'interpretare,
it's very
al di là di
difficult
tutto
to
il
read
tema
out
delle
data, to
fake news,
interpret data, of course,
insomma tutto quello che è girato. Quindi tu hai fatto un
considering also there are
lavoro che
lots of
è
fake news and
meraviglioso,
so on and
quindi
so
ti abbiamo
forth.
voluto
So
assolutamente qui
your
con noi, non
job
solo
is
te, poi ci saranno anche
wonderful,
delle
and
altre
people that work
persone
with you, of course,
insieme a te,
will also
però ti
tell us
lascerei
something,
la
but
parola
I'd like
subito.
to give you the floor.
Se
Grazie
So you
Cosmano.
can tell us something straight away.
condividi il tuo schermo,
So if
Sì,
you
sì,
share
parto.
your screen for the presentation, please.
Eccoci.
ci siamo quasi
Okay.
Paolo.
Paolo, we're almost there.
Ditemi quando ci siamo.
Dovremmo
Tell me
quasi
when you're ready.
esserci.
Almost
C'è
ready.
naturalmente un po' di latenza, ma
Un po' di delay.
secondo me
There's
ci
a bit
siamo.
of delay, but-
Ecco qua Paolo,
Okay.
io lascio a te la
Here we
parola.
are, Paolo.
Grazie mille.
Ottimo.
The floor is yours.
Grazie Cosmano.
Thank you very much, Cosmano.
Breve premessa. Dovrò essere molto
A
veloce, ho
short
cercato di
introduction.
riassumere in pochissimo
I
tempo
tried to
un po'
sum
di
up
materiale che ho creato in
in a very
questi
short time,
giorni.
lots of material
La
that
volontà è
I've
stata
been
quella di
creating over the
cercare
last few
di
days.
far
The
capire a
priority
tutti
was to make
banalmente come
everybody able to
interpretare i
understand
dati che ogni
how to
giorno ci
interpret
arrivano
the data we receive
dalla
on a daily
protezione
basis
civile innanzitutto,
from
ma
the
anche
civil
poi filtrati
protection
dal mondo
forces
dei
and
mass
also
media.
that are
Perciò
filtered
come possiamo leggere
by
i
the
dati? E
mass
quando
media
leggiamo i
world.
dati,
How can we read
appunto la
data? When
condicio
do we
sine
read
qua non
data?
è quella di partire sempre da fonti dei dati attendibili. Queste sono quelle che ritengo maggiormente attendibili. Ho segnalato John Hopkins, che è stata una dei primi a seguire l'evento, e in Italia Protezione Civile, l'ISS chiaramente. Come acquisiamo il dato nelle statistiche perciò del coronavirus? Ci sono i primi sintomi, a quel punto si arriva a fare un tampone, nel caso in cui il tampone sia positivo puoi andare o in quarantena domestica o venire ospedalizzato, quindi guarire, se peggiori vai in terapia intensiva, anche lì puoi guarire, oppure può esserci un decesso. Questo è il percorso che dobbiamo tenere presente anche in termini di acquisizione del dato. Quindi abbiamo come metriche di base i contagi totali, i casi attivi, che sono quelli appunto ancora infettati in quarantena domestica, ospedalizzati in terapia intensiva, e che poi si trasformano in casi chiusi, che sono i guariti e purtroppo i decessi. Queste sono le nostre metriche di base da tenere sempre presente. Il problema è che a volte quando ce le dicono velocemente non riusciamo a capire di cosa stanno parlando. Il percorso statistico quindi della malattia si divide in casi attivi in un primo momento, che poi si trasformano in casi chiusi. Quando analizziamo i dati di un contagio, di un'epidemia, dobbiamo avere presente quello che io ho chiamato il concetto dell'onda. Tutte le epidemie formano a livello grafico un'onda. Questa è la spagnola in Prussia nel 1918, Zika all'Università del Rosario, ok, nel fine 2015, inizio 2016, Ebola 2014-2015, e questa è il Covid-19 in Corea. Come si può vedere quando analizziamo l'onda di quello che ho chiamato dei contagi giornalieri, i nuovi casi giornalieri, che non è il dato che ci dà purtroppo la protezione civile, che ci dà i nuovi attivi giornalieri, che è leggermente diverso. Comunque la metrica di base, che è quanti nuovi tamponi positivi avevamo avuto ogni giorno, abbiamo una prima fase in cui l'epidemia si espande, il famoso R con 0 maggiore di 1, una fase in cui si raggiunge il picco dell'epidemia, il famoso plateau R con 0 uguale circa intorno all'1, e una fase di diminuzione dell'epidemia. Questa è una curva classica. L'altro grafico che possiamo vedere riportato è quella invece dei contagi totali. Questa è una curva invece cumulata. Questo è il caso della Cina, dove chiaramente non potrà mai essere azzerata, ma l'obiettivo di contenere un'epidemia è quello di portare all'assoluto del limite del massimo questo tipo di curva. Questa è la curva dell'onda dei contagi totali perciò per la Corea del Sud. Questa è quella dei giornalieri. Come vedete, queste due curve rappresentano lo stesso fenomeno, stessa scala temporale, stesso fenomeno Covid, qua una scala cumulata e qua una scala giornaliera. Rappresentano lo stesso fenomeno. Qua ho una visione molto più ampia, diciamo, quasi una sintesi, un riassunto di quello che è successo. Qua una visione molto più che definisco in tempo reale, è uno zoom all'interno della curva precedente.
in the
Ma in che fase
previous
siamo in Italia,
graphic,
e questa è
basically.
la
But
giornata,
where we're at
con i
now
dati di
in
ieri?
Italy, this
La
is
famosa
yesterday's
onda totale
data,
dei contagi,
the
quella che deve a un certo
total
punto
infection wave,
continuare verso
which
un
is the one that
asintoto
should
non si
proceed
sta ancora
into
formando questo
plateau, which is,
asintoto.
however,
La
not
parte
there yet.
invece dei contagi
And this
giornalieri, dopo
is the
fase di
daily
espansione,
infections after
abbiamo
an
avuto
expansion
questo essere
phase.
sul plateau,
We
e
have
forse con
this
i
sort
dati
of
di ieri, l'altro
plateauing
ieri, teniamo
after
di vita,
yesterday, the
stiamo
day before
iniziando su
yesterday.
questa
We
curva
are
andare
starting
verso il basso. La
a
curva però
downward
importante da
trend.
seguire
But
in
most
questo
important
momento, che siamo
curve
ormai in una
to
fase
observe, to
avanzata
look at in this
dell'epidemia,
period
perciò
where we're in an
la
advanced
curva che
stage of the
dobbiamo
epidemic.
controllare maggiormente
So
per
the curve that we
capire
have to
quale sia lo
control
stress
in
sanitario a
a
cui è
strict way in order to
sottoposto il
understand
nostro
the
sistema, e
healthcare
per
system
capire
stress,
anche
and
quali
also
e come
in
ci
order to
siano
understand
possibilità di
if it is
riapertura
possible
per
to
settori, per fasce di
open
età e quant'altro.
economic
È
activities
questa, che è
again
la
or
curva
age
dell'andamento dei casi attivi, cioè
groups
le persone
again
che sono
is the
positive,
active
che è
cases, so the
calcolato
positive
come il totale
cases,
dei
and this is
casi
calculated as
meno
the total amount of
decessi
cases
meno
minus the
guariti.
deaths
Questa è la curva che adesso dobbiamo
minus
tenere
the
maggiormente sotto controllo.
healed
Questa
cases.
curva sta per
So this is what we
raggiungere il
have to keep under
famoso
control, and this curve is about to reach a
ancora non l'ha
peak.
raggiunto.
We haven't reached a peak yet.
Interpretare i dati.
How to
Tre cose
interpret data?
fondamentali da sapere.
Three vital
Uno,
things to
la
understand.
deviazione
The first
temporale.
thing is
Quando una
time
persona
deviation,
fa il
because
tampone
when
e
a
risulta
person gets
positivo,
tested and
rientra
turns
nel dato del
positive,
contagiato di oggi.
it's included in
Però
today's positive
chiaramente ha
cases.
iniziato
But
a
of
febbraio il
course,
Covid,
they
c'è stata
have
questa
been
malattia
affected by
prima.
COVID-19
Quindi
or any
abbiamo
other
una data dei primi
illnesses
sintomi che
before.
riusciamo a
So you've got a day for the first symptoms that is calculated, the date of onset, and this is calculated based on an interview and on the test. And so this date is called date of onset, as was said, and this is the Chinese curve, the Chinese diagram. This is very important. Thomas Way has written a very interesting article on this. The yellow line are the positive infections, so the data we receive on a daily basis. The blue line are the onset date. So today's date, or people that are asked today, when did you have the first symptoms, and you then have this line. This is very interesting because when China started the lockdown, as you can see, the infection was blocked straight away. But in the yellow curve, as you can see, there are still some positive tests. So basically, these are the people who were affected by the disease previously. So when you see at the beginning of a downward trend, you can see a distance of 15 days, for instance, for China. Or this, for instance, is March the 23rd. And in Italy, we had the lockdown on March 11th. And you can notice how after 11 days later, we are witnessing the first signs of downward trend for the daily infections. This data was confirmed by the ISS. So this is very recent data, very recent information, and the ISS is showing the outside data. And as you can see there from here, on March the 11th, when we locked down, you have the light blue data, which is still increasing and scaring us. But as a matter of fact, when everything was locked down, the infections slowed down and the number was reduced. And this is the reason why we're staying at home right now. So after 10 days, we have a 10 days delay for the calculation. Sometimes you can really tell by interpreting the data. Second, the test deviation, because data are disturbed by the number of tests performed. The more tests you do, the more cases you find. The blue line is the test line and the gray line is the infection line. There's a strong link, of course, a strong relationship, of course, but this is normal. So you have more people in the statistics, basically. So if we keep this data under control, we can see the positive tests with relation to the total tests. This is also very important data to take into account. The number of tests looks like it is diminishing the death rate. And of course, we also have to take into account the population of a country, which is very important data, and the relationship between the death rate and the relation. But Italy is one of the countries that made the most tests in the world, and also the way you do the tests changes things. And then, of course, the death deviation. Let's look at the path of the illness again. So here, now, only positive tests are part of the statistics. So all of the death you can see, they are people that underwent a test and were positive and either died because of COVID only or because of COVID and other previous symptoms and diseases or problems. When our healthcare system was stressed at the beginning, from the first symptoms to the test and hospitalization, there were 4 days and 5 days between these two last steps, so intensive therapy and death. And this is that you can find in the epidemiologic reports of March 2020. And the sad thing about our healthcare system is that our system is a bit collapsed, and therefore intensive therapy is not working in an efficient way. And there is a direct step between hospitalization and death, so leading to death directly. This is due to the collapse of the healthcare system, and this is also in the ISS data and in the report. As you can see, there are 5 days for intensive treatment and 5 days also for the ones that did not undergo intensive treatment. And therefore, in March 20, for instance, there was no treatment for these people, but they went the second path. When we look at the daily infection graphic and the death graphics, we don't have to overlap them on the same scale. We have to divide the scale into different axes because, of course, these are coming later. So there was a first stress for the healthcare system and a first death increase on the first days of March. You can see 6, 7 March, and the second stress around 8 March with an increase in the number of deaths and then a collapse of the system with a strong increase of death cases. And we've reached an infection peak now, and thank God this is also relenting the infection rate and the death rate. This is Spain, for instance, on March 25th, and so this is what happened pretty much everywhere else. USA, there were just a few death cases now, over 1,000. The UK was also a very critical time. France, also in France, was a critical situation. There is a stress in the healthcare system, an overload. And of course, there's an increase in the death rate because efficiency is less, and this path is interrupted, and you can have this phenomenon. The hospital system is also collapsing. There are less places, less treatments. People are not hospitalized. They are hospitalized later, too late sometimes to save them. And at some point, there is a collapse of the healthcare system. Also, the ER and the hospitals are really blocked and stuck. Ambulances waiting outside of the ER with people connected to oxygenation systems because the hospital was saturated and the ER as well. So sometimes you can't even have tests for people. In that case, you have death cases that are not counted, like in the last few days. For sure, we will never be able to count them, but for sure you also have those cases. Then COVID-19 and predictive models. We have to try to forecast the future, but not with a crystal ball, but with maths. This is something that we can do, and this is very crucial. You can do it with an epidemiological mathematical model. How does an epidemiological mathematical model starts? First of all, you have an empiric reporting activity and statistic witnessing on the phenomenon, and you've got 2 or 3 months time observation. Then you've got a basic function, like a linear function, trying to describe and to follow this empirical curve. And then you can model and shape this function with mathematical processes, like the Poisson regression, for instance, and you obtain a curve that more or less follows a model. But first and foremost, you get a function which describes the observed phenomenon over time. Obtaining such a function makes it possible for you to observe what's going on, what will happen in the future, because this gives you a timescale where you can project future perspective. And this is vital because it makes it possible for you to know what will happen. It's a sort of time machine created with a mathematical function, a real time machine, which has to be very precise, of course. How do you assess the accuracy of a mathematical model? You've got a function here that is represented on a time scale, and as soon as the phenomena are happening, you start measuring them and you understand whether the function is more or less precise if compared to the empirical data that you get day by day and measure over time. This is a less accurate function, for instance, and it's not following a mathematical model, and this is a model with an accurate mathematical function, so it can forecast with certain accuracy level and can assess what will happen in the future. The classical model to study epidemics is the SIR model. So it's based on a susceptible population, which is a blue line, an eligible population. Then you've got infection in red, and black for the death cases. So the virus basically rushes over the population and makes and works on the population. Applying the SIR model on COVID was possible, and these two mathematicians did that. Professor Luigi Brugnano, a professor of numeric analysis in the University of Florence, and Felice Iavernaro, associate professor in the Bari University, two very great mathematicians in Italy, and they applied the SIR model to COVID-19 in Italy. This was the application of the SIR model. As you can see, you've got the dots for the empirical data, so protezione civile data, civil protection data, and the blue curve, the function. At the beginning, the model was working very good and was very accurate, but at a certain point, it was a bit wrong, as you can see, especially here. The SIR model cannot be fully applied to COVID-19 because it's a new virus, because it has different outbreak waves, also on a territorial basis, and the two professors modified the SIR model and came out with MR-SIR by Brugnano and Iavernaro model, and they applied it by dividing Italy into different areas: northern Italy, central and southern Italy and Isles. This is what we had the previous days, and this is yesterday's diagram with the active cases. You can see, so in 3 days' time, we should reach the peak of active cases and finally have a downturn trend. See how precise this model is, especially in the curves and in central and southern parts of Italy, where you have more fear, basically. So this model is extremely precise, and this is great, I think, because a mathematical model is a time machine and can give you past and future scenarios. The time machine that was invented by these two mathematicians should give an answer to the questions: what would have happened if, and what would happen if. And this is vital in a pandemic and in coexistence during a pandemic, and in case new pandemic waves will come. What would have happened if we had no lockdown? This was also calculated without the lockdown, red line, with lockdown, mathematical model, and you look at the data, how precise they are. Without the lockdown, we would have doubled the number of active cases, so 170,000 instead of 90,000. And we've been calculating in a very conservative way, because we basically projected the healthcare model of the Lombardy region all over the other regions, so we weren't that conservative, how many deaths would we have had without lockdown? Without the lockdown in Italy today, we would have had 60,000 and more deaths without lockdown. So basically, with the lockdown, we saved all of these lives, 40,000 people. Basically, this is a sacrifice we're doing in order to save those lives, especially their lives. And this is something we owe to Luigi and Felice. So people like them can really help in these difficult situations. And they can help right now. They can help our country to make the right decisions, because we will understand the impact of this epidemic. Luigi and Felice, can you please help me?
Okay, good afternoon to all of you.
Paolo, mi senti?
Paolo, can you hear me?
Grazie mille davvero.
Okay, thank you so much for your explanation, for describing data. Before giving the floor to Luigi and Felice, let me add a comment. First of all, you have been talking about the sacrifice, and what we are doing now is helping us saving 40,000 people. So also for all the people watching us from home, well, I know that some countries are adopting measures right now, but when you talk to entrepreneurs or business people, I mean, if we think back in March, 23rd of March, well, we couldn't understand it properly. We thought we could have a normal life, and we did not understood data. So thank you for explaining data. Thank you for explaining it. You know, Luigi and Felice knew that this model that I have explained let us foresee what is going to happen in 30 days. And this is paramount, this is critical. I mean, it's like a sailing without any equipment. This is an important instrument we have. So Luigi and Felice, they are connected with us. So let's start from Luigi, a mathematician from University of Florence. Good afternoon, Luigi. Oh, actually, sorry, we have Felice first. Thank you for inviting me. Thank you for accepting our invitation. Thank you for the work you are carrying out. Would you like to add something or to tell us something more about what you are doing as mathematicians? Nobody knows what you are doing, but actually this is so useful. Would you like to give us your point of view? And of course, we thank you for the work you're doing. Well, I would like to thank you for involving us during this outstanding event. Well, actually, this project was started as a game, I would say, because the first data were published following the same criteria. But looking at data, it was quite clear that we needed formulas and equations. At first, we used static ones, but then in the very last chart, you can see that the equations were the result of the evolutionary models. So basically, you consider you start from parameters, and all the parameters were used to best fit data. So once you have adapted the parameters to data, then you can see that the model and its solutions can help us foresee the future, foresee the situation in the days to come, in particular in the future and in the short term, but also in the long term. And all this made it possible, for example, to set a first goal, which was to identify the peak day. So the day starting from which we would have seen the curve to flatten and to decline, which means a decline in daily new cases. Because if the number of new cases decreases, well, at the same time, the risk of catching the virus decreases as well. From this point of view, I can tell you that, well, as you know, we don't have vaccines or no specific treatment for the virus. So the only weapon we have, also from a mathematical point of view, is social distancing, because social distancing decreases the risk of catching the virus. And since we don't have drugs, this is the only weapon, this is the only solution we have in order also to improve the situation in the future. Thank you. Thank you, Felice. Is Luigi connected? We just wait for Luigi.
Vediamo. Non hai il microfono acceso, Luigi, se puoi accenderlo. Mi dicono dalla regia.
Luigi, if you can
Paolo, questi dati,
switch on the mic, and we wait for you. But in the meantime, Paolo, you said that you already knew all that, and you have data.
Luigi.
Okay, so Luigi is connected now. Can you hear us?
Sì, adesso ti sento.
Buonasera,
okay.
Sì, ti sentiamo.
We can hear you, and we can see you as well. Okay.
Ricordiamo, tu sei sei a Firenze?
You are in Florence, right? Yes, I teach at the University of Florence, a mathematical faculty. And as Felice was saying, well, we started it like playing with data. We wanted to understand the evolution of the pandemic, and we relied on established tools to look at the future. And at a certain point, we realized that what we had was not reliable. So we developed a new model, which is actually the model we are using currently. So this means that by adapting the modeling, we can also understand what is going on and how the system works. We do approximations, of course. We are quite satisfied for the time being, but of course we have to fine-tune and to improve our model. Can we see Paolo as well?
Eccoci. Paolo, niente, davvero, l'ho detto già un paio di volte, però volevo ringraziarti anche per averci parlato, no? Insomma, di loro due, perché è
thank you for introducing them, and thank you for talking about scientific research, because for many years I have to say that the research studies were not considered enough. So I think this is an important message. I mean, we watch the news, and very often we got the wrong ones, or people sometimes believe that the central government decisions are something they would they don't like to follow, but we are happy that we had the chance to talk about data and to start from evidence. And of course, we will wait for the daily data at 6 p.m. today from the civil protection. I also would like to convey this message. Felice and Luigi did all that as volunteers with the instruments. We had an opportunity to actually exchange with other experts, and as I have already said, we are actually trying to raise funds because we would like to improve our computing tools, and we would like to set up a group, a work group, in order to improve and increase the computing power and in order to support decision makers with evidence. We really want to help decision makers, but to do so, well, this is quite a wide project, and we know that the community is supporting us. Yes, of course, our community is supporting you. We will help you. Thank you so much. Thank you for accepting our invitation, and of course, we will be waiting to hear data at 6 p.m. Okay, so we had a picture of the situation about data. We also have seen that some models can help us in decision making, but now I would like to move to technological innovation and digital innovation and what such innovation can do to help us in such a difficult situation. Let's start with video clip. We have with us Giorgio Metta, Scientific Director of the Italian Institute of Technology. Good afternoon, Giorgio. Welcome. How are you? I'm fine. Where are you? I'm in Genoa. I'm at home, of course. First of all, you are the director of the Italian Institute of Technology, and more than 700 researchers from 60 countries all over the world work for your institute. So this is really the heart of Italian research. And we really want to promote your work, and we would like to understand what you're doing and how your institute is reacting to this emergency. Well, there is a practical aspect. So we want to carry out research, of course, but at the same time, we try and find practical solutions to the emergency caused by coronavirus. So we had to find new ways. So smart working was necessary, and but at the same time we wanted to continue to work at our labs. But at the same time, we made our engineers and researchers available to the country in order to develop solutions to face such an emergency. Starting from drug simulations to mask adaptation, or even the manufacturing of adapters or parts which are needed for respirators, for example. And at the same time, data analysis or even image analysis because we are trying to create apps for social distancing as well. We are working in many different fields, and we try and do something useful and do that in a very fast way. We know that you also work in the robotics, which has a lot to do with what we are facing today. Well, what is surprising is that our engineers came up with many and varied solutions. For example, the 3D printing for parts for respirators, or the manufacturing of full face masks, or even using our molecular analysis in order to understand what products are the most effective ones. So all this was done, of course, in a hurry, because in such a situation, well, we can decide anything, but it is important to get to the final product as soon as possible. So we looked for simple solutions and solutions that could be applied fast. Robotics, maybe this belongs to the future. I think robotics will be really useful in the future, for example, to make sure that plants and factories work, even if we reduce the number of workers, so in order to ensure that we continue to produce and manufacture. We, of course, trust your work and robotics, in particular, the very positive applications in the healthcare industry. I have another question for you, and after you, actually, our friends from Isinnova will take the floor, and they have patented a specific valve for respirator. But I have a question for you first. Now, we can say that the scientific community in the last few months was not listened to, and I mean, the opinion of the scientific community was not taken into consideration enough. What do you think about the future? Is the role of scientific community is going to change or not? Well, of course, I am a member of a scientific community, and I think that we should all rely on science, in particular, when very difficult decisions have to be taken. We should look at scientific evidence. We should look at data. So this is, I think, the most important message we would like to convey. So we should trust, we should be confident and trust science and the scientific community. For the aftermath, well, I think that investing in research, in the app creation, well, this is the best way to restart and to go back to our normal lives. We must not forget science and research, because otherwise we wouldn't have foundations for competitiveness. This was true in the past, but it will be even more important in the future. Thank you so much. Thank you to the director of the IIT, and thank you to all the researchers. Right, so we are now really digging into innovation and how innovation can improve our society and can help us face such a difficult situation. And the next speakers will be examples of Italian creativity and innovation, so very talented people who came up with ideas in order to face the coronavirus difficulties. And let's start with the next speaker. Let's watch a video clip together.
So today with us is Lorenzo Abeni, Marco Ruocco, both from Isinnova. Good afternoon. Good afternoon. So guys, together with your Isinnova team, you are created out of the blue something that went into the newspaper headlines, all of the magazines and newspapers. So basically you had this invention, this idea of patenting the Decathlon mask respirator. Everybody knows that now. It's something that is well known. But first of all, we'd like to thank you because this application, this patent, is for sure useful for everybody, not just in Italy. Can you please tell us something about it, how you came to the idea of this patent? Tell us something. So first of all, let's say that what started the whole thing was something that happened a few days before the Decathlon mask, because we came out with this valve, which is a mixing valve to mix oxygen before administering oxygen to intensive therapy patients. A hospital in our area ran out of these valves. The supplier wasn't able to supply the valves on time or in reasonable time to tackle with emergency. And so the Brescia Society is very small, and we know each other in terms of 3D printing facilities and so on and so forth. So the hospital was in touch with us. We tried to understand what we could do. We took a valve, and thanks to our team, we printed some of the valves and brought them to the hospital. They tested them, they were working, and therefore this event had media impact, of course, and the main physician of the therapy unit explained this to everybody, and also found a very vital component for the masks and asked us to develop it. So we tried to understand what we could do. And the idea was to use something that was already available in the market and possibly change it, modify it in order to adapt it to intensive therapy treatment. And the mask that was very well known all over the world, it's a very well-known and widespread snorkeling mask by Decathlon, was the ideal element. We understood how to change it, to adapt it, and then we came out with this valve, this connection valve, or as connection unit. So we came out with injection molds for 3D printing, and we printed it. And of course, all of the makers were involved in this. All of those who wanted to cover it in a platform made themselves available to cover it with the hospitals and print. So we asked Decathlon as well to make the project of the masks available. There were associations that collected the masks and sanitized the masks in order to use them, and the project started then. Several hospitals are actually using these devices. So this is the whole picture, and this is a description of how the patent was introduced. So you showed us the main stages. What are the relationships you have with the hospitals right now, and what are the next steps for the future? Well, at first the project was introduced in Lombardy, and the Chiari Hospital was very precious for tests of those patients, especially for medical reports and advice. And then we started with the Brescia Hospital as well, which is bigger and more important in terms of tests we can perform. But in the meantime, the idea was published in newspapers, and the main hospitals in Italy started to call us. So Rovere Hospital, Novara Hospital, Messina Hospital, Tuscan hospitals. So it's no longer under our control, basically, but this is positive because our idea was to implement an open source project where demand and offer could meet each other without any intermediate partner without any bottleneck in a way in between, because of course we weren't able to manage the whole demand all over Italy. And therefore, we publish everything in our website, which is www.isinnova.it, easy COVID-19. And we made everything available to the hospitals. And the offer was so wide that we had to come up with an industrial mold. We also expanded to foreign countries. In average development countries like Tunisia, Uzbekistan, and other countries, but also advanced countries like Germany, UK, US. And we're also in touch with some Southeast Asian countries which wanted the file and asked for some explanations of the project in order to implement the project in those countries as well. So the project went well and went how we planned, because it's an open source project and many hospitals independently implemented their masks and their experimentation stages. So we stated, of course, that this tool has to be used in emergency situations when certified medical devices are no longer available, depending on the requests, of course, and the numbers, of course. But overall, the feedback was very positive because hospitals keep using them. We are still cooperating with the hospitals in our area to improve the system, to make tests. We're also in touch with institutions and official bodies who asked us to make some tests and wanted some reports to show that everything is going well as it is supposed to be. And of course, everything turned into an international cooperation. In our website, when we opened the makers form, we asked the makers to volunteer and to make themselves available on a voluntary basis. And now if we look at the website, we've got a long list of makers from all over the world, from Africa, from South America and the rest of the world. We've got over 1,700 makers from all over the world, private people or companies, bigger, smaller companies who really made themselves available for the tests and to implement the project. This is very good, a very beautiful thing that happened in Italy, but also all over the world. So giving a vision of how important cooperation is the main thing about it, because it's a grassroots level digital innovation. So based on this network, many people were involved. All the makers are very active in this sense. After you, Paolo Mirabelli will tell us something. He's doing something from Cosenza, working on these topics as well. And he is... So we can see how innovation is like music, something that reaches everybody, really. I also wanted to ask you to clarify something that is a question mark for many people, so certified devices and products, because, of course, it's all about it as well. The system was patented, so you've got an invention that is patented, and then products have to be certified. Can you tell us something more about it? So that people that are following us from home, from all over the world, can get this information. Yes, I'm going to do something, then Marco can possibly add something. So we thought that the best way to disseminate the project was to use the so-called compassionate care. So basically, in clear emergency cases and just in emergency cases, when an official supplier is not able to supply the official product, it is allowed, based on the hospital's consent and on the patient's consent. So you need to have two authorizations to use non-certified products. In case, for instance, you need to save a patient's life and you don't have an official product, but you have a non-certified product that can save a life, then it is possible to use it, or at least temporarily. even if you don't have any CE marking. But of course, the ministry and other official bodies need to approve compassionate care as well. Of course, for compassionate care, you need to have some tests. So, although these tests are not as detailed and through as the certification tests, but still they can be reliable. As Isinnova, we have little experience in the medical field, namely with another product we are developing, which has nothing to do with COVID. But we know how long the red tape is, to get all the certifications and to get all of the tests done. These certifications are unfortunately not compatible with emergency situations because, of course, the time that you need to get the certification is too long for an emergency situation. So we made an instrument, a tool available for physicians, for doctors to use it when they deem it necessary. From the certification point of view, as Lorenzo said, we've got the authorization to compassionate care use, and this is something that some hospitals are doing in order to use the system and optimize it. Of course, everything's also based on the doctor's conscience and experience. Some topics are very delicate, of course, but we are still cooperating with institutions and hospitals in order to shape all of this, in order to reassure users as well. The situation has not been unlocked yet, but a project was started, which is a different project than the Isinnova one, which will, however, have an impact after the COVID emergency. When the emergency will stop, we will, of course, carry on with this project, and we will conclude it and achieve all of the necessary certifications and steps. And of course, we will make a more in-depth analysis and work. Thank you very much for your work, you and your team. You confirm the sentence that is written behind you. Ideas without execution, without implementation, are hallucinations. So thank you very much for your work and take care. Okay, very well. So we've listened to how this idea was created and how these masks can be used. Let's now have a look at how other makers are working, because of course there's a strong grassroots level cooperation between them. This is something that is very important to me because it happens in a very important region for me, Calabria. There's a story about how the situation is being tackled, the coronavirus situation. There are areas where innovation is advancing at a very intense pace. But of course, there are areas where some vital elements are neglected, have been neglected for a very long time. And in Calabria, our healthcare system has been neglected for a very long time and was lagging behind. So we should have an interest in these areas like Calabria. And there are people like me, like Paolo, or other innovators that are taking care of these areas. So this is also an invitation, so an appeal to you to start again, to think about a new model, a model that is different from the previous one, of the recent years. Of course, in these regions, like in Calabria, there is another risk. So the commissioner Lombardo, he has the same surname as I have, but is not a relative of mine. There's another risk in these regions, the mafia, the 'ndrangheta, which can have an influence on the healthcare system, of course. So we think that it's important to work together with technological and digital innovation to change the way we do politics. But having said that, let's go back to technological and digital innovation, this grassroots level work of the people that are innovating. And I'd like to invite Paolo Mirabelli. Good afternoon, Paolo.
Good afternoon. How are you? I'm fine. I have a broken knee, but I'm at home and so I can do lots of things. Okay, we have been talking to each other quite a lot, and we know that a lot of makers and manufacturers are doing a lot of things. We will have a platform available soon for interaction. Can you tell us more about what you are doing in order to combat such virus and provide solutions for this crisis? Well, everything has been hectic and fast. I was working in my pajamas, and some projects just started in a very natural way, and we wanted to come up with solutions, even partial ones. And so we met on Facebook, but also through local groups, and we try, first of all, to be careful and to think a lot about what we're doing. So we just don't want to print whatever. We want to be very careful and working with a lot of makers and players. And we do that not for profit, and this is important. I just would like to make a comment. You said printing. I mean, printing for you, of course, you're talking about 3D printing, but can you tell us more in terms of 3D printing? Well, we started in 2012, but now I'm still in love with 3D printing, which is the best way to manufacture products. We are in Cosenza, in the south of Italy. We are working on an intubation box, which is quite simple. So we should have come up with this idea much earlier. So basically, I met a doctor, and we had to create a clear box made of polycarbonate for the intubation of patients, ensuring safety, in particular safety of workers and healthcare workers. So this is the project, and this is what I invented at home. So this is the intubation box, and this is helpful for patients, of course. And we also have another project. The project is aimed at modifying masks. Of course, we have been collaborating with international groups, and basically in Milan, they do design the product and I do print the product myself, and then the product is tested. So the idea is to create personal protective equipment for the healthcare workers. And I think we have been working on that for 14 days continuously. So we design, we print, and we test the products. Of course, we want to ensure the safety standards, the safety of physicians and patients, of course. Of course, we are in an emergency. And, for example, I discovered that at the university of my city, they do have a lab where they test products and where they can test products. Of course, we know that these products are for compassionate use, but before providing these products to the workers, we want at least to test them, which is something which is still missing. Do you have something to show us? I can show you the intubation box. It is the clear box that you see over there. Okay, we can see it. I get in closer. It's such a simple idea that you really think I should have done that much before. It's like a barrier, basically. We are also adapting and changing it, so we want to make it even more smart. And I want to disclose what we are doing, but for example, we would like it to become a sort of a globe box, and we are also working on sensors. And I think that tomorrow, the first box will reach the hospital, and the head of the hospital will test it and see whether it is possible to test it with the patient. Okay, now we can see you perfectly. Okay. A very last question for you. As Maurizio was saying, there is now a strong network of cooperation. Can you confirm it internationally among all makers, but also all the people interested in innovation? So in your city, but also in other parts of the world. Well, actually, when there is a need which rises, then you see a lot of calls, and a lot of people want to participate. Of course, this cooperation is international, so worldwide. The most important thing to us is to find research documents to be inspired of in order to take best practices. And it is very important to meet researchers or to get into contact with experts and professionals. For example, in Milan, are dealing with these things for such a long time. So everything is faster, everything is open source, and we have created, for example, a specific dedicated account with no reference to companies or universities. So the model is made available to everybody. Every person can download and use it or modify it, and everything is so fast. It's happening so fast that sometimes I don't even have time to wear clean clothes or to get rest, because you want your knowledge and know-how to be shared and to be made available to other people. So we just don't want to print whatever, but we want to be based on evidence, because we try to satisfy needs, but at the same time complying with the safety standards. Well, congratulations for what you are doing. It would be nice to see such a cooperation throughout the year, not just in a time of emergency. Thank you so much for accepting our invitation. Thank you. So, Isinnova, that was the first company. Then we have talked to Paolo Mirabelli. And now we would like to show you another project, a project about a mechanical ventilator. The project is carried out in Milan, and the next speaker is Giuseppe Gorini.
Good afternoon, Giuseppe. Good afternoon. Everything fine? Yes, pretty much. Connected from Milan? Yes. I'm speaking to you from the University of Milan. Okay, we were talking about this Italian innovation project. We will go on to international projects later on from other parts of the world, and we will be dealing with projects that will be launched. So we've got startups which are going to implement these projects, but now we are talking about other projects such as yours. You are working at a ventilator, for instance. Can you please tell us something about it? Yes. We'll use a presentation to make myself clearer. Yes, you can share your screen. Once again, Giuseppe's working in the Bicocca University of Milan. They are developing a ventilator. And this is a project belonging to the university, developed in the university. So, are we ready with the presentation? Yes. Okay. Yes. The name is Milano Ventilatore Meccanico, mechanical Milano ventilator, and I work in the Bicocca University of Milan. But this started, of course, within a wider cooperation project. The main idea is this. You can see a very simple description of the object itself and how it's going to be produced as a first complete prototype. So it's a ventilator that can be used for any patient's requirements in the COVID emergency. So the idea really started and came from Christian Gabbiati, a professor of the Tristan University. And we started an international cooperation with them. And in a few weeks' time, the cooperation brought about these results. In the picture, you can see a shot from our experience when the device was developed in the top version. Here you can see Professor Carlo Moppelli of the Polytechnical Unit of the University of Milan. But the main idea of this device is to simplify components, to make mechanical components as simple as possible, especially in the pneumatic system. And this for a very simple reason. In order to make reproduction easier. So to produce a big amount of such devices in a short time. In order to do this, of course, it is necessary to have all of the components available in the market. In such a situation, like today's situations, where we have a block of all of the borders and activities, it's of course difficult to get these components, especially in Italy. So we made the mechanical functioning easier, and thanks to an ECU, an electronic unit, we can manage the whole system. The ECU is, on the other hand, very sophisticated and very complex in order to comply with all of the necessary requirements in the clinical field. So in order to have a better performance. So these are the two main aspects, combined aspects we want to implement and which are also the novelty in this product. Simplification also brings about cost reduction, implies cost reduction. This is the functioning diagram of the system. It's not that interesting to see the details, but in the end to understand that the number of components is quite limited. So here you can see a detailed picture of the device during the tests. In the middle, you can see the ECU, the electronic unit, the control unit that has to control the whole device, the whole components in the device. So this adventure, so to speak, started a few weeks ago based on the idea by Christian Gabbiati, and many other subjects and people took part in this initiative. Research institutions in Italy and abroad. So in the national field, so in Italy we can see in general that the institutions wanted to reply to this demand, to this emergency. So we managed to involve INFN, several universities in Lombardy, the Science Institute, the CNR, and many companies came in as well, together with Elemaster, for instance, which is a company in the Lecco province where tests are being performed, and other companies joined in as well. We invited them. We, as scientists, invited these companies, also based on the relationships we had with them, because, of course, these are the companies that are usually helping us implementing bigger research projects, because they are making instruments and equipment available to us for the tests, for scientific experimenting and experimentation. So they basically made themselves available and helped us in this new challenge. So, Professor, in terms of timing, when do you think you will be able to implement this or to make it available? Well, we're about to test the first device, the first complete device. I can show you something. This is a CAD picture, so a 3D simulation picture. And of course, we will produce some units like this. This is a 0 version. We will then have another first version, different version, for production by the end of the month. So in a very short time, basically. Yes, in a few weeks' time. We've got just a few weeks' time. And everything, of course, depends on the results of the tests we are performing right now. But together with us, there's a whole network of international laboratories working with us. So not just the Italian part, but also US, Canada labs, and several practices have already been implemented to get the approval for use in these countries. So we're pretty sure that in a few weeks' time, we will have a production of the same devices also in those countries, because a very important aspect is that all of this is open license. So basically, research and project results will be completely free and available for everybody, for anybody who wants to reproduce, change, or adapt the devices for local needs. So we hope we can give our contribution to the emergency situation, not just in Italy, in the US or in Canada, but maybe also in other countries. Why not? This is something that we are repeating over and over again. This open source, this free cooperation is very important at an international level. I've got a last question for you. Can you hear me? Maybe we've got connection problems. However, Giuseppe has explained and outlined the project, and the project will be ready by the end of the month. And this will be a very practical contribution to the current situation. So we've seen a part of research and technological innovation, 3D printing, and we want to really valorize and appreciate the work of researchers, not just in terms of scientific research, but also technological research. Now, we're going to talk about a molecular study aimed at understanding how to stop the COVID epidemic. This is something we'll talk about with the next presentation with Lidia Pieri, Civila Biotech. Good afternoon.
Good afternoon to you and to all the people watching us. First of all, where are you now? I'm at home. I live in Verona. You know that we have a lot of people connected from all over the world. We do have translation into English, of course. Now, you told me something about your study, and your work is a very practical contribution. So I would like you to describe your project. I think you have a presentation. Yes, my presentation is in English, and so this is, of course, in order to help people watching us from abroad. Well, you can decide speak English or Italian. It's up to you, of course. Would you prefer to speak in English?
It's okay.
Yes, okay.
So can you see my screen?
Yes. Okay.
Great.
Now it's okay.
So can I start? Great. So the question is it possible to combine new biotechnologies and modern supercomputers to find a cure for COVID-19? This would be really great. At Sibilla Biotech, we have a cutting-edge new drug discovery technology, and we would like to use it. And the INFN, that is the Italian National Institute for Nuclear Physics, has let us exploit a significant amount of the supercomputers which were used to discover the Higgs boson at CERN, from Higgs boson to biology. Well, this allows us finally to work on COVID disease. At Sibilla Biotech, we discover molecules that can become new drugs. Now, in general, drug discovery is based on finding small molecules which impair the biological activity of specific proteins. There is a problem somehow. Some proteins are apparently undruggable. In Sibilla, we try to drug them because we act in a completely different way. We use an innovative drug discovery protocol that has been developed by our founders. In particular, we use computers and protein folding simulations. Let's see what it means. So what are proteins? Proteins are the molecular nanomachines that perform most of the biological function in cells. All the info about the chemical structure of a protein is encoded in the gene and written down in the RNA. Then the ribosome prints this information in the form of a linear chain of amino acids. At this point, the protein folds and reaches the final conformation, which is called the native state. Only once the native state is reached, the protein becomes biologically active. And traditional pharmacology acts here on the native state to block the biological function of the protein. Instead, we act before, during the folding process. In particular, we stop the folding process in order to suppress the protein expression in cell. How can we do that? Well, during the protein folding, the system spends a lot of time in intermediate states. So we can identify molecules that bind to these intermediate states and interrupt the folding process. So what happens? The protein doesn't get to the native state, and the cell recognizes a problem in this partially unfolded protein and destroys it through a quality control mechanism. This is why our technology is called PPI-FIT, that is to say pharmacological protein inactivation by folding intermediate targeting. So we don't allow the protein to get its biological function. Now note, targeting an intermediate state could not be done before. Why? Because in order to do that, you have to perform a protein folding simulation at atomic resolution. The standard computational methods would take much more than a human life to simulate the folding of biologically relevant proteins. However, our scientists have developed a more powerful approach which exploits mathematical methods taken from theoretical physics. And this allows us to perform this protein folding simulation with atomic resolution. I think that this innovation is really a beautiful example of how fundamental research can improve the real world. And this in particular was carried out by a researcher of the Italian National Institute for Nuclear Physics. That's why we have this link, which was so important with INFN. Now, our technology has been tested using our new protocol for drug discovery, PPI-FIT. We have actually been able to find molecules which could suppress the expression of different proteins in cells. Look at this example. These are experimental data and show that when the cell is exposed to the molecules that we find with our approach, the expression level of the target protein is reduced. Proteins are disappearing inside the cell. Now, let's understand how Sibilla can help in finding a therapy against COVID. Everyone sadly knows this graph. We want to target a protein which is called ACE2. This protein is the cellular receptor of the virus. That is to say, the key that the coronavirus uses to enter the cell and start the viral replication cycle. Now, if we decrease the level, the number of ACE2 in cells, this would reduce the infectious power of the virus. But more important and more generally, ACE2 was reported to be the cellular receptor of both SARS-CoV-1, the virus that caused the epidemic in 2002, and the present SARS-CoV-2. This means that a compound found which is capable of reducing its expression in cell could be useful now, of course, but also possibly in the case of future coronavirus pandemics. This is our pipeline. It consists of 4 steps. First, we have to characterize the protein folding pathway of ACE2. This requires a very large amount of computing time, and we could significantly speed up the simulation as INFN has given us access to their computational infrastructure. After we characterize the druggable pocket on the intermediate state of this protein, we will run a drug screening campaign to find a potential drug. And then we go on in wet lab. We go to the lab in order to test the effect of such molecules in vitro. To test this effect both as far as the expression of ACE2 is concerned as in the case of its effect on the virus. Now look at this movie. It's beautiful, isn't it? This is the preliminary result showing one folding pathway of ACE2. Note that actually the chain spends time in a few intermediate configurations before getting to the native state. We are using 3,000 computing cores of INFN, and in 2 weeks of calculations, we will produce plenty of simulations like this to achieve statistical significance. Here is an example of a well-structured intermediate state that we have already found. And actually, we are very close to the end of the first step of our pipeline because we will be able to release and publish the results on the intermediate state soon after Easter. And then these results will be made available to the scientific community because we hope that everybody that can help will work on this. So this is the people that makes it possible inside Sibilla. Founders and workers. All of them are very important. So I think I can stop.
Okay. Lidia.
Sì? Ti sento ma non riesco a togliere la condivisione dello schermo.
Non ti preoccupare, va benissimo. Va benissimo.
Okay. So the main goal is to block, to stop the virus before it enters the cells, to make sure it doesn't have the key to enter into the cells. And you're saying this is important for the SARS-CoV-2, but could be important also for other viruses. Yes, because such a cell receptor is common to SARS-CoV-1 and SARS-CoV-2, so the pandemic in 2002 and the current pandemic caused by SARS-CoV-2. of course, we hope there won't be a third epidemic, but if this happens, it is likely that the virus is going to use the same receptor. We hope we have a treatment for COVID-19, and we hope to have a drug soon. And if we manage to do that, we will be ready to face other pandemics caused by SARS-like viruses. Now, it is quite clear that scientific research has been supported by also the technological instruments. You have computing instruments which are so important, and this is very important. So scientific research on one side and technologies on the other. Yes, it was a very fast response, a synergy together with INFN, and we started from the research, basic research, and with the basic research, well, you think about so many things, but then when you have the technological transfer, which comes from basic research, well, this is important because you can use your creativity, the talent of researchers, and then you can create a business line. And when the emergency started, we at Sibilla, we decided to invest our resources in ACE2 folding, but with our resources, that process would have been too long, so we contacted the INFN, and they made available to us computational power that was really impressive. I've been working at CERN so many years ago, and these computers actually were made available to us, and we are just a startup, but this actually confirms that everybody's trying to collaborate. It is a very strong collaboration. So collaboration between general practitioners, but also the decision makers of our cities and towns, and so the collaboration between them would be also important. So social innovation as well could be involved, and we hope all the best for the future. Thank you so much for describing your project, and I wish you all the best. Thank you. Now, the next speakers will be dealing with the future and how reinterpret or think about the future. But before that, we would like to show you a very short video clip.
Mi assento 5 minuti?
This is our Lions Quarantine. This is what we have invented in order to describe what is going on during these days. Thank you to Roberto, Davide Nazzari, and Simone Sabazzino. Thank you for their creativity, for creating these video clips, and we will see many of them also in the next days. But now let's start with a new panel. How can we think or rethink about the future? We start with a video clip to introduce the next speaker. We have with us Francesco Morace. Good afternoon, Francesco. Good afternoon to all of you. How are you? Fine, thank you. Of course, there is a lot of work for us. We are living a sort of a sociological lab, and we try to provide inputs of what to do and what is going to happen. So we are here. I listen to the other speakers. There is a lot to talk about, a lot to say, but also a lot to do. There are so many people, so many organizations, not-for-profit made organizations, citizens or startups that are working. And I have seen you on TV, and you deal with so many topics from a sociological point of view, but also looking at the future. And I would like to ask you a question, and a question for you. So, in your opinion, do you think that we made a mistake in the past? If you look at the situation right now, something went wrong some way. Well, it is a very smart, very good question. And actually, a few weeks ago, I actually posted something that became viral, because in my opinion we made a lot of mistakes, and this situation today is telling us what is the right direction to follow, because we are being attacked in the way we breathe. So we know that our respiratory tract is affected, but at the same time, pollution is decreasing. And also this pandemic is teaching parents to spend time with their kids, and parents are rediscovering the pleasure of staying with their kids. And also another important lesson is about the huge potential of digital technologies that allow for both virtual and real meeting. We were not used to use digital technologies in Italy when it comes to school or smart working. Of course, I don't want to think of a digital future, but nonetheless, we can do quite a lot. We can find a way in between. So there are a lot of things that we didn't do in the past. We are forced today to do that. The important thing is that we won't forget it when the pandemic will be over. For example, also in terms of eating, of a diet, we used to eat carbs and protein, but now we are eating lots of meat, lots of proteins. So basically, we also have to find the right diet when it comes to digital technologies as well. But I also have to say that we are kind of worried in particular, if you look at digitization on one side and education. We are in Italy, and we want schools to use digital technologies. A lot of schools didn't want to, but now this trend is so fast. But I'm kind of worried because people start to think that education can be done through digital technologies. But I think that education is something different, something that goes beyond digital technologies. Well, this is a real worry, and we are actually listening to people and to the stories of people during the lockdown, and people are staying at home. They have been staying home for 4 weeks now, and after so many weeks and lots of digital technologies, while people are asking for human contact. You know that at supermarkets, lots of people are buying flour and yeast. So people is making bread, cakes. So on one side, there is a lot of digital technologies, but at the same time, we have to find the right balance. Well, in the past, we did it wrong because technologies was not used enough, but in the future, we can't look or use technologies only. And we know, for example, that at workplace, creativity or great ideas, they come up when people meet, when they have a coffee. And so this is not possible through the digital world. So we have to find the right balance between the two. And what about relationships between different generations? Because we are now going back to natural things, but what do you think when our lives will go back to normality, so the relations will be back? Do you think that the relationships between generations will be different or not? Well, they are already changing, because if you look at teenagers, for example, teenagers had to stay at home, and they had been spending so much time using computers or smartphones. Well, we now know, we have seen that the relationships between parents and kids, well, a lot of teenagers, a lot of young people taught their grandparents to use Skype or platforms to, for example, to learn cooking recipes. So there is such a relationship between generations, and in this case, teenagers are teaching to the older generation. So when the pandemic will be over, this shouldn't be forgotten. Teenagers must have responsibilities, they must play an active role, and at the same time, we as parents, we must convey the right messages. And also, researchers or experts now are being listened to. They are really at the center of our lives. And in the past, it was like everybody could have his or her own ideas, but now we are there to listen to experts and scientists. And so I think this is really the new starting point for a new social model. The model we had didn't work properly, so we can't now forget all this. We should start from knowledge, from research, from the scientific community. And maybe communication was also managed in the wrong way. And so that was responsible for the biased information. So not just looking at profit, but I think that propaganda as well was to blame for. A very last comment I would like to make is that we should be truth-centered. So trust in truth, which means that we have to be confident in truth, and we must rely on evidence, on data, on figures. Unfortunately, such pandemic taught us that every day at 6 p.m. we get information from the civil protection, and we get data and figures. So we must look at the common good, which means mutuality, responsibility will be very important, will play a major role. And we should not forget this time, because this will be, I hope, the incubator for a better world, a word in which we can, of course, hug and shake hands once again, but at the same time, common rules and mutuality to be defended. Thank you so much. Thank you to Francesco. I will be talking to you soon and talk about future trends in a very near future. Thank you so much.
Thank you very much, Francesco. But let's invite the next guest. We already have him. He's also going to talk about a new future, a construction of a new future, not just from the sociological point of view. So let's listen to Maurizio Carta. Good afternoon, Maurizio. Here I am, Cosmano. How are you? Super happy seeing you, being here with you. Of course, I've got a little bit of nostalgia for the warmth of the Web Marketing Festival. That's a very strong feeling, but we will soon be there again, and we will catch up with what we've lost. It will be even stronger, I know. Yeah, Maurizio. So we're talking about cooperation, about the future, and about how we're going to start again concrete, practical projects. And later on during this day, we will listen to 9 Italian projects, and later on 6 international projects. But now I'm going to give you the floor for your presentation, because I'm very curious about what you're about to say. So, do you want to share your screen with us? Yes, of course. I've prepared a few slides. You are speaking from Palermo, right? Yes. And we will also have an in-depth interview at a later stage in our YouTube channel and other media channels, in order to have an in-depth analysis of the topic. Also because there's another topic, the borghi, the little towns and small Italian towns projects. We are sharing, and we will have some in-depth analysis of that as well. But now, I'd like to share with you the need to start thinking about the future, the aftermath, how our cities will change. And my point of view as an urbanist is this sentence by Patrick Jets, which has always been a beacon for me. Individuals, by acting together in the collective interest, the constructive principle of urbanistic, can really change reality. This was from 1915, and I think this sentence is still true today, and it refers to landscapes and cities and urbanistic perspectives. So we know that after the Industrial Revolution, for the whole 19th century, there was a strong acceleration, especially in the 20th century, and the humanity has been thinking in this sense. So being enthusiastic of being in the Anthropocene, this is a very good example of this. So we think we are in the fabulous Anthropocene, but this is the reality of Anthropocene, a very, very strong environmental footprint. Look at this. If we were to deform the countries based on the environmental impact, we will have such an impact. Look at how massive our impact on the world is. It really reflects some modern representations of the planet. But of course, we also have an unsustainable consumption of raw materials on the planet, and also a lack of equality throughout the world. This is the world's vision, a deformed vision based on lack of access to water for people. This is the Anthropocene. And then this, the signs of devastation, practical actions caused by Anthropocene. This is the aftermath of Katrina, the hurricane, then the fire in Australia, and more recently the rise of the laguna in Venice. And this is a sort of ultimatum from the planet. I think the Earth has given us several signs: global warming, climate change, but we apparently weren't listening to it. So we went on in our progress, in our development, and this microscopic virus was sent to us to convince us that we have to change our mankind horizon. We couldn't keep on thinking that such a complex path of innovation could last with us as predators. This is a representation of Italy made by the University of Bergamo. Look at how Italy can be represented based on the infection. So it becomes evident that some features of modern times have speeded up the contagion, the infection. And you can notice the same pattern in the most developed countries. So China, USA, Europe, India. So you can see how the coronavirus is expanding based on the advancement, the progress level of the countries. This is what we did. We have been an enemy to our planet and to species living on our planet. We thought we were a dominant species without respecting the other species, and we created an unsustainable metabolism, like this wonderful graffiti in favelas in South America. So the Anthropocene dream has become, to all intents and purposes, a nightmare. And therefore we need to work for a different present. In a different present. The problem is not imagining or thinking about a new future. From my point of view, the urbanistic point of view, my interest is planning a new future based on a new present, a different present. Also because we are different. We're not just an unsustainable environmental footprint. We can generate value. We can generate something positive, as you can see. And we also want to protect cultural and environmental resources. This is the UNESCO World Heritage List sites, for instance. All the sites that are protected by the UNESCO. Or just look at the Nobel Prizes for literature since 1901. So we're not just predators. We're also a creative dominant species, so we need to act for the new Anthropocene revolution. We need to understand our Anthropocenism can be creative and can be revolutionary. So we need to do 4 things. First of all, rethink the network society. We need to rethink our society constantly. We need to accelerate digital transformation, which is something we are doing out of need, of course. It was a very important thing that came in during the crisis. We need to rethink how we share spaces, how we share functions, economies, and how we share lifestyles. And then, of course, we need to combat climate change, to fight against climate change in a proactive way against what's happening to our planet. And the response of the urbanistic perspective is this: none. No answer to this question. Basically, we cannot hide the mistakes that we in urbanistic development have done, because all of our answers were old-fashioned, like these plans from 1860, where the issue of health was somehow taken into account. This was after the pandemic, of course, 1860, but also the machine city, so segregated city, like in the Corbusier perspective. But this is too far away from what we need for our society. So we need a paradigm shift. So the augmented cities need to act in 10 dimensions in order to tackle the 4 challenges I've been mentioning: network society, digital transformation, circular society, and climate change. But luckily enough, in order to start planning the future, the aftermath, we have some vanguards of new Anthropocene. We're not starting from scratch, because some signs were already given to us. So David Price, wonderful UK architect, planned this palace in hybrid multifunctional structure without any specific plan, but able to adapt to different needs and requirements of the people using it. We would need such places able to adapt to different requirements. So in 1964, a working city, a city that can move, that can live based on the requirement of movement we have, or a radical representation of balloons, like surviving capsules for the pandemic we would need nowadays. It looks like a very modern picture, but it's from 1966. This is to tell you that we need to experiment and to move on to a new dimension of our cities. We need to think of cities as coral reefs. That's to say, circularity, diversity. This is how we will tackle the challenges we're facing right now. Can you tell me? Yeah, you can go on. So, some experimentation with Mario Cucinelli and Patrizia Monte and other colleagues. We've been experimenting a model of augmented city, circular city in Città Vecchia of Taranto, the old city centre. Then, together with other colleagues, we gathered together in order to think about a new future for other cities, like Gibellina, for instance. There are cities that are starting doing this. They are doing, for instance, Cultural Park in the southern part of Sicily. We are having such an activity, a different way of living and housing. So this is expanding in different areas. Or our colleagues in other cities in Italy, they have a lab which is a theatre and also an education place, smart working venue. So we need experimentation, because the city of the future needs to be able to make functions hybrid, to mix functions, to join them together. And this is a time where in our houses we're thinking about it, because we think, for instance, that our houses must be able to adapt to a more flexible situation, to exchange. And of course, when we will be back to public spaces, we need to rethink spaces. I have written a book on this, and for sure we can have further dialogue on this if you want. This was just an introduction. Okay, Maurizio, very enlightening. Thank you very much. We've got lots of questions for the future, for the aftermath, but yes. You've also mentioned 4 bullet points, among which also climate change. And you introduced the next topic, because in a short time we will also listen to Mr. Mercalli. And there's another topic I'd like to tackle with you, the borghi, the little towns and fortress towns in Italy, because the borghi are conceived in a very peculiar way, and when it comes to cities, this concept can also apply to borghi, basically. But I think that they've been neglected over the last few years. So we need to launch a project together with those who are living in these small cities, in the borghi, in the small towns. And for sure you will have an opportunity to say something on that as well. Of course, that's also relevant because we haven't just neglected the borghi, but also forgot the lesson they are teaching us, because they are self-sufficient communities that can work perfectly in themselves. So paying attention to the borghi means going back to a different human habitat that can give you the utmost creativity and the best relationship between the people in the community and harmony in a community. So it's important to work in these topics for sure. This is the last thing I'd like to say. With some friends, Flavio Brenci and other friends as well, we created a new platform that is called Dopo, afterwards. And I'd like to have an exchange between platforms, okay, so that we can share our discoveries. Yes, for sure, we will do something in this sense. But thank you very much for now. Very beautiful pictures. The coral reef image was very, very interesting to rethink the world. So thank you once again.
Right, it was very interesting speech, and lots of people say that when Maurizio Carta speaks, basically, it's like lots of tweets and important statements. Actually, he has introduced the next topic, which is climate change and coronavirus, because this was one of the 4 challenges, global challenges. So education, healthcare, but also digital transformation and climate change. So climate change is one of the 4 challenges. And we would like also to talk about the link between climate change and coronavirus. We have 2 speakers. The next one is Matteo Campofiorito. Hello, Matteo. Please switch on the mic. Your mic is off.
Vediamo. Ho sbagliato anche il tuo cognome perché è Campofiorito. Ti chiedo scusa. Ci sei?
Adesso mi vedete?
Sì, ora ti
Okay, we can see you and we can hear you. Perfect.
Il mio cognome è sempre motivo di grande.
I know my last name is not easy to be said, but I mean, to me, actually, it is my name which is not easy. My name is Cosmano, so even my mom sometimes calls me in the wrong way. So first of all, where are you? I'm in Rome. I'm fine. Of course, I'm staying home. I have 2 small kids, and so managing work and family at the same time is not easy. So after you, we will have Luca Mercalli, but I first give the floor to you. I think you also have slides to share. Okay, so the floor to you. And the topic is climate change and coronavirus. Okay, I hope you can see my slides. Okay, I would like to skip just the very first slide about what I do. I really would like to talk about climate change and the hot topic of my speech, of my presentation. So what is coronavirus doing? Well, it is quite clear from the healthcare point of view, it is really devastating. But At the same time, if you want to look at something positive, let me pass it. Well, thanks to the coronavirus, we have recorded a drop in nitrogen dioxide. This is made of two atoms of oxygen and nitrogen, and this is the result of combustion, in particular diesel engines from our cars. And this gas is extremely harmful because it can cause fatal diseases. In Italy, unfortunately, I have to say that we are first. Italy is the country in which we have the highest number of deaths caused by nitrogen dioxide, 14,600 deaths. So it is extremely harmful and widespread in our cities. Now, the coronavirus led to the lockdown starting from China. And already there, so during the first lockdown in China, we understood that the shutting down of factories' activities, the fact of staying at home, not using transport, in particular combustion engines, so all this resulted in a significant drop in nitrogen dioxide. This is, for example, a picture from NASA, and you can see the before and after the lockdown. So the areas in yellow and brown, these are where nitrogen dioxide is concentrated. But look at the picture after the lockdown. You see how the situation has changed. And in China, not only a drop in nitrogen dioxide was recorded, but also CO2 emissions dropped considerably, 25% less, which means 200 million tons of CO2. And this is really a lot. Such a drop, such a decline in pollutants in the atmosphere was clear in all the cities affected by coronavirus and lockdowns. For example, the European Environmental Agency confirmed that due to the lockdown, the nitrogen dioxide was decreasing so much in Milan, in Rome. For example, 26 to 35% decrease if compared to the previous year, and also in Bergamo. So these are the biggest cities in Italy where there is a lot of traffic and lots of manufacturing going on, but the same trends are being reported also in other countries, in particular where the lockdowns have been implemented. For example, in Spain, in this case, also nitrogen dioxide dropped significantly. And with this slide, you see the whole Europe, and these data are taken from Sentinel-5P satellites, and all these pictures are processed by platform, and they clearly show such a change. Of course, this is in a limited period of time, but if you look at nitrogen dioxide concentration, the data are completely different compared to the situation before the lockdown. If you look at the purple areas, these are where there was the highest concentration of nitrogen dioxide, and that was before. And now you look at the situation after the lockdown. So once the lockdown measures were adopted, well, the consequence was that the concentration in nitrogen dioxide decreased significantly. Now, starting from the picture, so how the situation is now, I also would like to think of possible solutions or ideas in order to really have or implement a paradigm shift, in particular looking at what we do in our cities, how we move in our cities. So far, we have been free and we thought we can do whatever we want. And I have to say that the choices we have made were not, let's say, in favor of air. Unfortunately, such a painful experience, which is the pandemic, can teach us something good. For example, we could really implement smart working policies. We could think of some days dedicated to smart working, mandatory, of course, for the companies who can do that, so that there will be some days in which traffic is considerably reduced. We have some measures, for example, during Sunday, where vehicle traffic is prohibited, but we could come up with more ideas. For example, at least once a week, having a smart working day in order to reduce the nitrogen dioxide concentrations, and also shifting to electric mobility. Well, we have started in a way, but looking at this crisis, we should look at both private and public electric mobility. So we should transform or convert diesel buses to electric or hydrogen buses, so ones which are not pollutant. And the same could be done by implementing urban intermodality policies. So basically, in our cities, we should use different means of transportation, particular public transportation, to go to work, for example, using the underground, for example, but also bikes or scooters or electric bicycles as well. So thanks to all these different means of transportation, we could no longer use cars, for example. Thank you. Thank you, Matteo. I would like really to thank you for your message. We are a bit late, so we have to give the floor to the next speaker, but I'm sure we will meet again. I would like to thank you once more for your contribution, and thank you. Have a good day. Thank you so much for your inputs and suggestions. Thank you.
Thank you. So we're getting into climate change, a topic we will also tackle with the next guest, which I'm going to introduce with this video. So, with us, Luca Mercalli. Good evening. Good evening, everybody. How are you? Very well, I would say. Where are you calling from? And surroundings of Turin, Bassa Valle di Susa, my home, of course. Like everybody else. Thank you very much for being here with us. So we're getting step by step into the nitty-gritty of this topic. So we've been talking about COVID, of course, innovative projects from all over the world. Once again, everything's being translated into English. And with this chat with you, I wanted to start with this question. There have been studies, recent studies, showing a correlation between global temperature, coronavirus, and temperature in hot countries, for instance, warm countries, cold countries. There are lots of questions about this, but can you tell us something about this? So your opinion. Of course, this is a very weak hypothesis. It's just an empirical observation that we had. So since the very beginning of health crisis after China, so Italy, but now all over Europe, Southern Central Europe and the US, all this area is a temperate climate and fresh, cool climate area. Tropical areas where the demographic concentration is very high and you would expect an even stronger outbreak, they are basically safe. So there's not much more to say. It could just be a delay in the outbreak, or there could be a relationship between the transmission of the infection and environmental conditions. In very cold countries like Russia, for instance, you don't have so many cases of infection. In the tropical area as well, maybe there is a link in terms of infection transmission. In 1 month's time, we will clear up this doubt for sure, because if the virus will not impact in some countries, then we will find out whether there are some geographical and environmental causes for this. It's too soon to say this, of course, or to come up with a truth or a statement, but it's just a track we can follow. In the end, we can also deny everything or demonstrate the opposite, but in the meantime, we're observing this trend. Another question about the climate change. But in the meantime, I want to ask you a question about current data, because by looking at current data, as you can see, the waters are cleaner. There are studies that are demonstrating how the environmental impact in China and Italy has been reduced. Are we learning something from this virus in terms of environmental impact or human footprint on the environment? Well, I would say so. Or do we have to learn a lesson for the aftermath? Well, the basic lesson is that we shouldn't be resuming with the same rules and uses and habits we had before. Of course, the economy was different before the virus. There was an open conflict between the economy and the natural environment. This is something we're aware of. There were lots and lots of studies and also warnings in terms of climate change, biodiversity threats, ocean pollution, plastic pollution, topics that we tackled, but we never really answered to these questions. Now something new came about because something stopped the world economy. We were able to stop the world economy in order to protect higher values like life, health, and we learned that we can do it. So it would be better to do it without such a big threat or a catastrophe like the virus, but maybe doing that by planning and with a reasonable serendipity in order to give up something and keep something else. I think that this is the most important lesson, learning that economy has been ruling us so far too much. The laws governing the world are the real laws we have to take into account. If our choices are always subject to economy, look, for instance, at the delay in implementing self-isolation, for instance, the restrictions. We've been doing this relatively early in Italy, but we could have done it even earlier. And look at the other European countries, which didn't see the problem. I'm not talking about China, but I'm talking about Italy, which is even closer to the other European countries, UK, France, and so on and so forth. They didn't perceive the threat. And on the other hand, they were afraid of copying our procedures in tackling the virus because they were fearing economic consequences. Of course, we will be losing money. it will be an economic catastrophe, but of course, health is even more important. When you have deaths, then you can realize it was a big problem. So economy is not something that we need to serve. Economy has to serve mankind. So, for instance, we can afford a temporary lockdown, a temporary economic stop, because we need to understand what rules are compatible with the environment and mankind. It's not a war we lost. We just ask people to be a bit quieter, to stop their pace or to slow down their pace, especially in the world production, and this brought about the result we've seen before. So an immediate effect in terms of environmental pollution and also in terms of pressure on the ecosystem. So we need to bring together these two visions, a less dominant economy on our choices, so with less impact on our choices, and an economy that is more based on our real needs, and mankind that is able to stop or slow down when it is necessary to do so. Can you still hear me? Yes, I can hear you very well. There are some thoughts that I had in this period of time, but I wanted to share them with you. I want to hear your opinion. There's a contrast between the management of the environmental problems and the management of this emergency on a global level. For instance, an absence, a lack of international coordination as far as this topic is concerned. Of course, since many years we've been observing the environmental problems. On the other hand, there was a sort of a neglection approach to what was happening in terms of health emergency. In Italy, for instance, we were considered as crazy, as mad people at the very beginning. And also, if compared to what happened in China. But I think this is the same approach we have in terms of environmental challenge. So the rainforest problem disappeared. Nobody's doing anything about it. I see common aspects in this sense between the health and environmental emergency. Yes, I think the same. But in terms of environmental changes, climate changes, the UN conferences being held over and over again, and nobody came to a final decision in terms of reducing emissions. For climate, this involves the whole country, of course, the whole world, sorry. Some countries, for the COVID emergency, think they can escape the emergency, but nobody can escape climate change because we're surrounded by gas, the atmosphere, and this will impact everybody with no exclusion. So I don't understand why there's no concrete position on this. Maybe the reason for this is that the consequences are more diluted over time. The epidemic is something we're witnessing in an outbreak. In a few days' time, people get ill. They can die in a week's time. When it comes to climate change, everything looks like diluted over time or belated or impacting the future generations. Whereas we know that the climate change is already ongoing and it's similar to an epidemic, and it's no less dangerous. The epidemic can end, whereas climate change will stay for centuries. This is something we have to understand. Another message I tried to read out is that the environment is like telling us, humans, you are part of the whole thing. You're part of it. Basically, you can stay home. You are not possessing things. You're just a part of it all. Maybe this is a wrong message I've interpreted, but I think this is something we can learn from this situation, don't you? Well, of course, this comes from one of the fundamental laws of ecology. The mankind is not an alien species of this planet. It's the product of an evolution of the other species on this planet. So it's a sort of result of physical, chemical, biological laws governing the Earth and over the last 4 billion years. And as such, we need to respect these physical laws. We don't have to exploit everything at our own will or pleasure, because this will have consequences like climate change, pollution, we mentioned before, putting our health at risk, of course, or risking losing other species or diseases, illnesses due to polluting agents that we ingest, for instance, like plastic in the oceans that we're also eating. Everything's connected, but we know this since a century at least. So ecology has been founded around the half of the 19th century. This is something we've known since ages, but we've always been ignoring this for economical reasons, for the economy. So we need to respect the environment, but respecting the environment means using less the resources that we thought were endless. Of course, we need to change this. We need to stop using raw materials and use renewable energies maybe, and reducing waste, of course, because everything that you put under your carpet will come back to you. In terms of climate change, in terms of noxious agents for our health, also in terms of virus. Because the appearance of this noxious virus for mankind is a result of a devastation of natural environments where mankind is in contact, in touch with the wildlife. In that case, you can have species leap. You can either do it in the forest by disturbing or destroying the ecosystems, like Lloyd says in Spillover, in the book, which has become a bestseller. It was written in 2013, so we can't say that this book is a sort of novelty, but you can do this in farms, cattle farms, or other farming activities. So, on one hand, science has understood this since many centuries, but this understanding has to be implemented in everyday life, in people's lives. So we are part of a biosphere, and as such, we need to comply with the rules. If we don't comply with the rules, we will have negative consequences for us, ourselves, and for the future generations. Okay, very well. So hopefully we will learn this lesson. Before giving the floor to the next speaker, I'd like to show you a comic that was drawn by Fabiana, our colleague. So you with the flag of the future, because you are implementing activities for a better future. So we wanted to show you this image. Thank you very much once again, and take care. Yes, and have a good food for thought session. Thank you very much. So we are getting closer to innovation projects, the Italian projects first of all. They will be introduced by Giorgia Palmas. Then we will have the international contributions as well. Before coming back, we also have a guest from China. Giorgia Palmas will introduce the projects. And before that, we have a very short video. Lions quarantine once again.
It's time for us to use technology for the good of humanity.
Ci vediamo domani, cari colleghi. Vado a farmi una bella corsa
See you
all'aria
tomorrow,
aperta.
dear colleagues. I'm going to have a
Ciao,
jogging
ciao.
session
Ciao,
outside.
domani.
Bye-bye. See you tomorrow. Alliance Quarantine. I'd like to thank them for the video. It's a way to have fun also during these days. We'll have to stay home, but let's get now to the innovative projects for COVID solutions. And we're going to introduce them with another colleague of us. A colleague of ours in a startup company in Hong Kong, Christian Secchi.
Hello, Christian.
Ci senti? Come stai?
Hello, how are you?
Tutto bene. Mi trovo in un
I'm fine. I'm at an empty office in Hong Kong. What time is it there?
10:52.
It is 10:52 p.m. Thank you for waiting for us, but we really wanted to start the next session about innovative projects with you or from you, because you started with a startup, but now you are based on Hong Kong, because your company actually is based in China. So before giving you the floor, and we would like to know about your company, about what to do, but we would like also to know your point of view. How did you face the epidemic in China? I know you since so many years, and we have been talking a lot. Can you tell us something from your point of view? You know, we have people following us from all over the world. You're being translating to English. So, first of all, share your video if you have a presentation or some pictures to show us. But in the meantime, if you can give us your point of view. We wait just for a few seconds.
Siamo a 11.000 chilometri di distanza.
We are 11,000 kilometers far away from you. So first of all, what is the situation there? How did you live it? Well, first of all, I thought that Giorgia Palmas was with you, but she's not there. If you can share your screen so that we can see your slides. Well, in the meantime, since we don't have so much time, well, in Hong Kong, the situation is fluctuating. We have an office in Shenzhen and in Hong Kong. We do develop the software, so we had lockdown in China for 1 month. Our team was more working from home. Then now they are reopening, in China. We are restarting production, so our team is working in China, but now in Hong Kong, we are working from home since 3 weeks. As we said, coronavirus has different waves, and we are facing the third wave. So at first, the schools were closed, public offices, but we could stroll around. But then at a given point, second wave hit China because there were people coming back from Europe or from the United States. So they started to close airports, to control people. And now we are facing a third wave because the trade with China is resuming. And so we do expect new infections, unfortunately. Having said this, we have to adapt. We started immediately with policies in order to continue our business. We implemented guidelines for smart working, and so you're saying that China is restarting. I mean, the second phase has started in China. We are not there yet, but I mean, they are opening some activities only. Is that the case? Yes, let me give you an example. In terms of manufacturing and production, we are 4 to 6 weeks late. In terms of logistics, well, for example, my partners in Shenzhen are working day and night to help our team in Italy to find masks or equipment hospitals are needing. And we unfortunately have to face red tape, bureaucracy, and a crisis in the supply chain because there are delays. We were not prepared, so there are delays in terms of logistics. But thanks to the right spirit, the right mind, we can resume our activities. We will do that in a different way. Our planet is asking us to slow down, to change the way we work, and we have to do that. Okay, now we can see your slides, so I give you the floor. Thank you. Actually, I have a question for you. Is e-commerce easy and practical to use? So basically, you, with just a click, you buy something and you get it the day after. Was it something you liked? Yes, of course. It was convenient. It was very practical. But all this has an impact on the environment. But actually, the coronavirus is telling us that we have to buy online, but all this has consequences, it has an impact. Let me share some figures with you. First of all, do you know how many parcels will be sent throughout the world by the end of my presentation? 2.5 million. In 4 years, the number of deliveries per person doubled from 12 to 23 per year. In 2018, almost 90 billion parcels were sent throughout the world, and a lot of them to Italy. And this data refer to the most advanced economies in the world. So the growth in the e-commerce is actually pushing and stressing carriers too much, and due to that, the number of vehicles, commercial vehicles, will reach 500 million by 2050, which means more CO2 emissions, more traffic, more pollution. So the world, will restart, but differently. So in order to reduce the number of vehicles on the road and the impact of deliveries, we developed Alfred, from the Batman movie, and it is a smart delivery platform. So basically, we use the deliveries of newspapers. So all e-commerce sites and all kiosks, in particular newspaper kiosks, are interconnected. So basically, we exploit the deliveries for the newspapers kiosks, and so basically we put the deliveries in common. One of the consequences Now try not to move the mic. You're very close to the mic. Okay. I also hear some noise from upstairs. Okay, so one of the consequences of e-commerce in terms of logistics is that the vehicles are not properly exploited, because the increase in the number of orders actually decreases the number of parcels loaded on each vehicle, which means that we have a lot of vehicles with fewer parcels, and they have to go to a higher number of places. So thanks to this software, we make deliveries more efficient, we load our vehicles fully, and we also increase the number of deliveries by stop. And basically, people go and get the parcels at places very close to their homes. So for deliveries with our system, you need 4 vehicles instead of 17. And so the software basically converts every shop in a delivery stop. And we are getting requests from all platforms and from all e-commerce platforms. And this service is also giving new life to newspapers, kiosks, because this is also offering new services and, for example, the possibility to pay bills or the N26 credit card or deliveries from Alfred points to other places. And let me thank newspaper kiosks, because despite coronavirus, the newspaper kiosks are open, and so we are there and we offer service to communities. There are people sending products from the south to the north, and there are people sending masks or hand sanitizers. So really, people need this type of logistics service. So I really would like to thank all these people. And, the situation is such. Urbanization is actually increasing the issue of deliveries, because by 2030, a lot of people will live in cities, and in 2 years' time, most of the commerce will be e-commerce. Such an increase means increasing vehicles and traffic, and some governments are looking for alternative solutions. For example, we are working together with the government in Singapore to create the first network of smart lockers for the deliveries. So basically, they are trying to replace the post boxes with these delivery points. In Brazil, we are working with a partner, and we use the delivery network for undergrounds. So basically, the lockers are at the underground stations, and we are serving communities which beforehand could not access it because, for example, carriers didn't go to favelas. So we are connecting online and offline world with very innovative solutions and, of course, making everything more efficient. Having said this, I would like to conclude. I would like to convey this message together with my partners. We are coming up with all possible ideas on our resources. We are reinvesting profits to make delivery logistics more sustainable and more digital. The best time to plant a tree was 20 years ago, but the second best time is right now. We have a huge opportunity before us. We can define the guidelines for the new world we would like to see restarting. Thank you. Thank you so much. I wish you all the best for your project, and I hope that the same will happen in Italy as well. Thank you, Christian. Thank you so much.
Okay, so Christian introduced the innovative project oriented to digital transformation with a low environmental impact, so logistics digitalization, and he has introduced the next stage, the innovative projects that were selected, together with the other ones that we will listen to later on from all over the world, projects in order to solve the COVID-19 problem. So I'm going to introduce all of these projects with a special guest. We're going to introduce with this video. Giorgia Palmas. Hello, Giorgia. Hi, Cosmano. Good afternoon, everybody. Good afternoon, all the guests that are connected with us. Good afternoon. People are following us not just from Italy, but also from all over the world. So your voice will be translating to English as well, but you're calling from Milan, right? Yes. I'm calling from Milan, from my home, where I am, of course, locked up in since a month or so, following the rule, applying for everybody. And I've been listening very actively to the previous speech. It was very interesting, the impact of e-commerce and the fact that we are experiencing a very difficult time, a tragic period of time from many points of view, but a period of time that can be an opportunity for us. And the opportunity starts from awareness. The awareness of how we've been living so far and how we will choose to live from now on by complying with rules today and setting new rules for tomorrow. Yes, that's true. We can do that. And we can also hope that these innovative projects will be implemented because they can really solve the coronavirus problem. So together we will present 2016, we've introduced our WMF Day, the startup competition. Now we're going to do something very similar because these are also very innovative projects and we're going to present them in a different way because you're at home and I'm here, so remotely. But let's see, we've got new projects, new startup projects, and there are 9 projects. They want to support, they want to help in this coronavirus emergency and support all the people that are involved. So, Cosmano, if you want, we can start straight away with the first one, the first startup company, which is PAGINEMEDICHE, medical pages. And we will have Antonella introducing the project. Antonella, are you there? Can you share your screen with us, please? Here she is. Please switch on your mic. So we've got a short delay, but we can hear you. Yes, we can hear you. I cannot see you, but I can hear you. Can you see my presentation now? Yes, we can. I can see, yes, we can all see it perfectly. PAGINEMEDICHE. So let's start with the first startup project for today. We're very curious about it, about your project. Just 1 second, Giorgia. I'm gonna be a human countdown. After 3 minutes, I'm gonna stop the presentation, okay? Okay, perfect then. PAGINEMEDICHE is a digital health platform with over 2 million users every month, which aims at connecting doctors and patients. So we wanted to be active in order to face the COVID-19 emergency. This is why we made our platform available with a set of innovative services. First of all, we've developed, starting from the government guidelines, an info chat, which really simulates a conversation with a doctor and makes it possible for patients or people to understand what the right behavior is based on the indications we get from our government and from the healthcare system. So you get correct information without overloading telephone lines, and you get medical help in order to understand also who people have to contact to get in touch with, the local physician, for instance, or the regional emergency number, and so on and so forth. 100,000 people have already interacted with our chatbot. Our project is part of the Solidarity project. It's sponsored by the Lombardy region. The region also uses this platform to gather information, to gather data. So we help in the epidemiological and retrospective analysis in order to cope with the COVID-19 emergency. For suspect cases, for patients who have symptoms but are still at home, there is a monitoring service we have implemented in order to support healthcare professionals and families who need some monitoring and some support. So we have clinical reports for every COVID patient, which is shared with the doctors, containing different parameters in order to better manage the case remotely. And as soon as these parameters get to a threshold value or they overcome the threshold, some alerts are sent to the physician, who can possibly activate a video analysis or inquiry with the patient. And this is a service that we send it to all of the Italian physicians. So they really have access to our platform, and they can use our service free of charge to visit the patients via web, via hub, and everything's reliable. Of course, it's GDPR compliant as well, and everything in a very short time. So 1,400 patients are currently managed with a video visit inquiry. So this is it. Thank you very much for your attention. Thank you, Antonella. Thank you. Giorgia, what did you say about this project? Well, Cosmano, I have to say it's very interesting for many reasons, because in a time where we're literally bombed with suggestions, rules, indications, having a direct connection with our doctors to understand what the right behavior is, then this is very good. Not just for symptoms connected with the coronavirus, but it's a direct connection that makes this application very interesting. I think that the next speaker has already established a connection for the second project presentation. Alessandro De Carlo, can you hear us? your mic. You have to switch on your microphone. Alessandro, we can see you, but we can't hear you. You have to switch on your microphone. Since this part is very short, very quick, please make sure you are switching on your microphones. We can now hear you. Okay, can you hear us? Yes. Perfect then. Giorgia, I would suggest to start with Alessandro's project. There's some lag, I have to say, and some echoing. Maybe you're using another device as well. Okay, now it's good. Okay, go on, you've got 3 minutes time. So, Limbix is the project name. So we use it in companies. And what do? We try to bring psychophysical health and performance for certain companies with virtual reality. And this will be important in the aftermath. We are a group of professionals from the university. Most of us are university professors. And we brought this technology to Italy, Limbix. It's a virtual reality visor that was developed specifically for psychology use. So clinical use, but also performance support use. The features of Limbix are that there is an immersive virtual reality. There are different environments that can be changed depending on the use. And it also makes it possible to use 360 degrees maps, so real places, virtualized places. And the professional can also take part in the vision because it can really see what the patient is seeing. So you can have a clinical use, or you can use it in order to increase the performance in psychological assistance or for psychophysical health. So we are trying to disseminate this as a culture for psychologists because we came out with a specific path for companies and for healthcare professionals because they are suffering very much from stress, and therefore we can use it with them to improve their lives. There are 4 sessions, one for deep breathing, and then another one virtual 3 things, positive things of life, then body focus and body awareness, and a 4th session on the best possible self, the best version you can have of yourself. These are the 4 purposes we use Limbix for. The 4 sessions for stress management, for managers, but also for operators. And we have, of course, professionals doing this. So we've got a very good performance in terms of productivity and improvement of well-being. We use a technology that is absolutely innovative at a world level. We can use it as a training session, also in terms of funding. We can receive fundings to this purpose. It's a more technical information maybe, but still it is a training activity, and it reduces risks and improves health. So we try, of course, to comply with the Italian legal framework as well. But we mainly help companies to start again with a better performance thanks to Limbix. There's still a lag in your voice, but okay. Next project. Are you going to introduce the next project? Yes. Thank you, Alessandro. Thanks. Very interesting. Very interesting. It's such a stressful moment for healthcare professionals who never stop working. All of the categories, all of the healthcare professionals have been working so far. The 3rd startup company is in silico trials, and Luca Emily will introduce the project. Good afternoon, everybody. Good afternoon, Giorgio. Because Giorgia and Cosmano. I'd like to ask Alessandro to stop sharing, because otherwise I can't share my screen with you. I am calling from Udine. I was skiing when Lombardy locked down, so I didn't manage to get home. I remained in a mountain apartment, and I had a few clothes with me, skiing garments mainly. And so, but I'm breathing a different air, definitely now in the mountains. So, In Silico Trials developed specific projects, a very specific project dealing with a very heartfelt problem nowadays. So the need for specific treatments for illness and diseases, such as in this case COVID-19. Now we can see the slides. There is a huge problem in terms of drugs and medical devices. So time and costs are huge. 2.5 billion for every new drug and 12 years or 15 years to develop them. We should have a vaccine that should be available, but we are told that we need months or years to get it. Medical devices are also requiring lots of money and years to be developed. In order to tackle all this in a very innovative and effective way, we decided to bring about other approaches to the life science world. So simulation, for instance. This is implemented in industries like the automotive industry, the engineering, aeronautics, appliances, and so on and so forth. So they're using simulations for all of their products. Every new car, every new plane is developed with a simulation. And then just in the end, only in the end, it's tested in the real world. All of the features, so the aerodynamics or structure resistance and so on and so forth, is studied through simulations, with simulations. So In Silico Trials is a company that can develop this through modeling and simulation, can speed up research and development and regulatory approval for drugs and medical devices. We select models that are made available by research and development companies that are famous all over the world. So, for the approval of drugs and so on and so forth. And we make these tools available to companies in order to speed up R&D activities, in order to cut on testing, developing and certifying times by 50%. These are some graphic examples of simulations for healthcare. This is a knee joint simulation with a prosthesis, or a stent simulation, or heart implants, valves, for instance, or spinal implants to correct scoliosis. And all of these applications are possible today thanks to the application of simulations before testing them on animals or human beings. So this enables us to reduce implementing time and also safety of the devices themselves, because they can be tested millions of times in computers before being tested in more expensive and slower environments like the real ones. So as to COVID-19, in order to give you a demonstration of what a possible application of the simulation can be, we've made this simulation that really simulates the diffusion of disinfecting spray agent in a building in different environments. So in the future, when we will leave our houses, we will go back to our offices or to our workplaces, we will definitely need to disinfect the environment, because COVID remains on surfaces for a certain amount of time, or in the air even. Air can be vectoring the virus and particles as well in closed environments, so indoor, and therefore it will be necessary to sanitize the indoor environment. So with this simulation, we can really plan the amount and the ideal positioning of the diffusers in order to reach all of the rooms in a specific amount of time with the disinfecting agent in order to sanitize all of the areas that need to be sanitized. So in order to avoid experimenting in real environments, we can use simulations. We can use extremely developed technologies in order to understand beforehand what we need to do in order to fight the virus and to implement prevention. Thank you very much, Luca. Thank you very much. Giorgia, this project is also very interesting. Very, very interesting, because technology can really speed up R&D times, and this is a very important and interesting thing. Okay. We have another project. You want to introduce it? Yes. The next startup company is Soft Mining, and we will have Stefano Piotto introducing the subject, the project. Hello, Stefano. The mic, please. Can you switch it on, please? Okay, some seconds, and Stefano will for sure switch on the microphone. I'm going to invite all of the startuppers, well, that's not the proper definition, but the innovators, please, they can share the screens, but don't switch off your microphone, please. Okay. So, Stefano, you can start with the project straight away. So, Soft Mining is a startup company using artificial intelligence for drug design, so to develop drugs. We've been using our technologies to do something different, though, because we had our problem, which is very well known. There is the infection of COVID-19. So 2 weeks ago, we developed an app which traces people's contacts. In order to do this, we needed to have a privacy-compliant approach, of course, if compared to the approaches that we use in Korea, for instance. So there's no geolocalization, there are no private data or sensitive data that are used, and just phones are used in order to monitor the contact and the duration of the contact. So basically, it's based on Bluetooth. Possibly you need a GPS in order to monitor these contacts. Every 60 seconds, mobile phones perceive and detect people around it, and this data are saved regularly on a database which the authorities can access to. And so when they make a test, for instance, they can even record it in the app, and the information will be shared in the network. So everybody will have this information, the information available on the smartphone. And this is important for two reasons, because individuals can, of course, be more responsible and adapt their behaviors in terms of contacts with their relatives or colleagues. And also for the healthcare professionals, this app is very important, because with this information, they can more effectively monitor possible infections. All of this information is then processed in order to avoid further infection. It's a way to estimate, to plan, and to forecast infections, future infections. And of course, then we'll need to go back to normal production, and therefore we will use it also in the future. The app is already available. It's open. The codes are available for the healthcare institutions. During the second stage, we will need to start again a new thing. For instance, this is a port, a harbor, for a factory, for instance. You can detect the areas where you have more risk of infection, or you can understand which employees among all of the employees can run more risks, and therefore they can possibly stay longer at home. So this was thanks to Soft Mining, but also to other friends who helped us, Nexus, Truckee, and Push Up, which I'd like to thank. Thank you very much, Stefano.
Thank you. Quite an interesting project. Traceability, well, our enemy is a virus, and tracking and is really important to contain infections. Yes, of course, and we have been talking a lot about China, and in China, an app was created right from the beginning, but I think that also in Italy we have lots of creativity. Let's move on to the next project. The name of the company, of the startup, is Yape, and the speaker is Sara Bergamaschi. Okay, I hope you can see my slides and you can hear me. Good afternoon. Our company is named Yape, and I have a short video to introduce our company. Yape is a way for smart delivery, and actually it can be used both indoor and outdoor, and we can deliver both post but also food or drugs throughout cities. Safety is very important to us. The software is based on algorithms that ensure safe stop and obstacle avoidance so that our system can overcome fixed obstacles like posts or people walking in the corridors. For example, it is a two-wheel vehicle. It can spin, but it can also change direction in a very narrow corridors. It uses a smart software. It can communicate, in particular, with the smart buildings, so that delivery is completely independent. Yape has a specific application for the recognition of the recipient of the parcel. Yape consists also of the two elements. It is a software platform I have already mentioned, and also a control room through which we can monitor it. So there is an operator who can monitor it, and in case of need, actually the droid can be controlled remotely to ensure that delivery is done in safety. So what kind of solutions do we offer? Well, we first try to contain as much as possible people movements within cities. And secondly, we try to avoid human contact, offering a delivery service which is based on a no contact service. As you have seen from the video, Yape is a very flexible solution because you can use it in different settings, and you can also deliver in different types of products, from food, but considering the current situation, Yape can also deliver drugs and medicines to people in quarantine who cannot leave their homes, and so it is quite difficult for them to get drugs. This is it. Thank you, Sara. Very fascinating project. We know that social distancing is the key word, and as Christian Sachi said, e-commerce has a huge impact on the environment. Yape is electronic, and so I think it also has a zero impact on the environment. It is very nice indeed, and very useful during this emergency, but not only. Let's move on to the next project. We have Sara Notar Giacomo from Accelerate. Hello, Sara. Okay, in order to talk about Accelerate, I would like to start from the rationale, from the reason why we created it. Well, we wanted to make of every computation efficient in terms of performances, energy consumption, but also times needed for data analysis. And the idea was to increase computational efficiency in quite an easy way. This is very important if you have lots of data to be analyzed or managed, for example, when it comes to genome, because often traditional technologies are not effective and it is not possible to get results in a very short term. And we know that today this is very important. We know that researchers today are developing diagnostic technologies in order to reduce the time needed for diagnosis. And we're also trying to develop solutions to contain the virus. When it comes to our process of research, well, of course, we have to consider the computational complexity of analyses, starting from diagnostic, but also considering the genome sequencing, but also imaging. We know that in terms of computational power, well, it requires a lot of that. We know that also when it comes to the search for vaccines, today we need really supercomputers worldwide, and we need resources to be made available to research. So the computational issue is a problem indeed. So what we do is to use our technology to create ad hoc computational solutions so that researchers can access computational solutions which are very specific and enable them analyze a lot of data. For example, when it comes to COVID-19, we made our solution available, genomic, which consists of two main sections. First of all, the applications which are used by researchers, which are already ready to be used, and they are already accelerated. And also we have a library, so a lot of functions which can actually boost our custom applications. We can accelerate what our scientists are using. And also it is a cloud-based technology, so it is easy, accessible, and it does not require important investment in terms of dedicated infrastructures. Thank you, Sara. Thank you for your presentation. You often say that time is money. Well, actually, today, time is life, is survival. So, shortening diagnostic time, well, this is very important, in particular in the situation we are living today. And actually, we really wanted this project to be known also abroad. We wanted to promote and give visibility to these projects also abroad. I think we have the next speaker connected. We have Claudio Celli with us. Hello, we can hear you. Claudia from Pazienti.it. Okay, so Pazienti.it is a hub. We offer a comprehensive experience to our users who usually search for health-related topic, and they can also talk to a specialist. Let me show you data. From March, 2 million people connecting to the platform, and we have people of any age. So users can contact a specialist from any place and from any device. And this is especially important for people having symptoms, and so they can talk to a physician to get a general, let's say, picture, general information, a general opinion. And then, of course, they can also talk to a second specialist. Or, as you can see here from this example, given the health emergency we're going through, we are using the platform a lot for people suffering from chronic illnesses. So in this case, practitioners can monitor patients through our platform and can monitor also the compliance of the patients. Of course, it goes without saying that this type of service is highly requested. And 1 month ago, we launched also an initiative of digital solidarity, allowing all people with the symptoms to get in contact with a pool of specialists free of charge. And we are really proud of this because we are supporting hundreds of people who every single day need to talk to a physician. And actually, we see that digital technologies can actually remove barriers when it comes to healthcare. This is it. Thank you, Claudia. Well, once more, removing barriers, in particular given the emergency we are facing, this is a great opportunity. But I hope that all this will continue in the future, because this type of technologies or these type of applications can be used also in the future. Talking to a practitioner, we can do that digitally, at least for a first opinion, for a general opinion. So this is kind of a lesson we can learn, which is exploiting digital technologies as much as possible. We have been talking about this with some of the speakers. I mean, the use of digital technologies has been booming during this time. Now let's move on to the very last project, the Italian one, and later on we will have speakers presenting projects from all over the world. Now we have a last speaker, Valentino Megale. He's already connected with us. Valentino from Softcare Studios. Hello to everybody. Softcare Studios is a startup working in the digital healthcare industry. Our mission is to improve the quality of life of patients. We use virtual reality in order to help patients go beyond and overcome the limits caused by disease or during hospitalization. I have to say that we are living kind of a unique moment, and all over the world we are at home and we are all facing the lockdown. Social distancing is needed in order to contain the spread of the virus. But this situation is perceived as negative or unnatural, but for a lot of patients with chronic diseases, well, this is just routine. This is normal life. So in 2017, we created Tommy, a project for pediatric patients in order to help young patients go beyond the walls of the hospital. This is for hospitalized patients. They can visit digital spaces. They can really reinvent relationships with their parents in order to, of course, reduce anxiety and stress during treatment and therapy. And over the next months, we will try and support and help patients. But I have to say that now we are all patients in a way. And technology is helping us. The technology is there already. And by using this type of virtual device, we can reach out to faraway places. We can also meet other people. We can take part in conferences in a digital way. So, for example, using AltSpace VR, or we can even make digital works of art using, for example, Tilt Brush by Google, or we can play and have fun with any person all over the world. So my message is that when we have limits, when we can't move, however, we can free our minds, and digital technologies can help us in this sense. The important thing, of course, is how we do use technologies. We must use them with a responsibility, being aware of technologies. We must use technologies to build relationships with other people and to create memories, of course. So we stay at home, but we free our mind. Thank you. Thank you, Valentino. Very interesting, because we are all at home, but at the same time, we also have to think about patients suffering from COVID-19, but also patients suffering from other diseases. And technologies can help us going beyond the walls of the hospitals. We can reduce the anxiety, the stress, and the fears. And when technology can do that, well, this is really a very important result. And we also launched a lot of initiatives about the fact that we should stop our body, but we should activate our mind, because we have to think about the future, the aftermath of the pandemic. Let me tell you two things that I liked the most. First of all these projects are supporting people, are supporting us, because we are going through a very difficult and unique time. But at the same time, we also have to remind people to use digital technologies, internet, in a responsible way, in a conscious way. We also said digital solidarity. Why is that? Because thanks to the digital technologies, we can shorten distances, we can offer services, and we can fix problems we are facing today. So solidarity, but digital solidarity is the key word today. There is also an initiative from the Ministry of Innovation about digital solidarity, and today we also talk about digital cooperation. Now, before say goodbye, I would like to show you a cartoon made for us. It is both of us and my small little dog. Polpetta is not actually Polpetta, Sansone, Caco. I have three. I have three of them. Thank you. Thank you, Giorgia, for sharing this moment with us. Thank you a lot.
Okay, very well. So we've been listening to this new 9 startup companies, Startup for the Future. They've been presenting the Italian projects. In short, we'll see also the international projects. Before the 6 p.m. break, we have a very important call, namely with the General Director of the Health, the healthcare hospital from Lodi, who is also managing the emergency in Codogno. So please connect us with Max Barawitza and Massimo Lombardo together. Both are dealing with an emergency. Good evening. Can you hear me well? Yes. We can hear very well. It's a pleasure for us to have you here tonight for this call, because for sure the situation we're experiencing right now in Italy is very strong, very difficult. So having you here with us, considering what you are managing in your area, is a great honor for us. So I'd like to thank you very much for sharing your time with us, taking your time to spend some interesting work with us and to foster international cooperation to find solutions, not just for the emergency right now, but also for the aftermath and to start again. So I'd like to start with a few questions to the General Director of the Lodi Hospital and the health care organization. So for you managing the Codogno emergency, what did it mean for you to be at the very heart of the epidemic? Sorry, the audio is very poor quality. So it's like being impacted by a massive machine, basically. So we had to change our reality deeply. There were lots and lots of people with symptoms. Sorry, we can't hear very well. It's probably due to the microphone. We can hear better now, maybe? Is it better now? Okay, I'm gonna speak closer to the microphone. Okay. I was saying it was like a huge emergency. So it meant many serious cases coming to our hospitals. We had to completely change the organization of our hospital. We needed to organize the areas. Please, we still have the problem. You probably need to lower the volume, to reduce the volume of the loudspeaker. Do you have some echo? How is it now? Good? Basically, we needed to reorganize our hospital, and this puts us in the spotlight in front of the world, of course. But this meant international cooperation too. Italian cooperation with other hospitals to understand what was going on. Many people worked with us and supported us. Sorry, we can't hear you. There's maybe a problem, a technical problem with your microphone, but it's very difficult to have a call with you. But in the meantime, I can ask Max a question. Since you are dealing with the communication, we've been talking together, you're supporting the municipality of Codogno in this situation. So managing this communication, how difficult it is for you? How difficult is it for you? Well, managing communication in such a crucial moment means two main purposes we're trying to attain constantly. The first goal is to have a communication that can help people understanding what's going on in and outside the hospital. And the General Director Lombardo and the crisis unit had a very good idea. Instead of closing down the hospital and making it a sort of castle or fortress in itself, they decided to use the media and cooperate with the media to talk to the audience in a very transparent and responsible way. So this was the first goal, so to provide information, to help people understand what the real problems are and to understand what the daily activities are for healthcare professionals. And the second aspect that is very interesting to me is that for such a small hospital in the province of a big city, so having such a big media attention, being in the spotlight at a national and international level and being on the press and so on and so forth, meant having a further stress, not just the stressful work the healthcare professionals had to perform. So the group that is working with me, the team working with me, has tried to become a connection between information requests and information feedback for the media, because media need information once or twice a day, and this is what we did. So these are probably the most important points. Let's try with the director again. So I try to wear some headphones. Let's see whether it works better. Now we can hear you perfectly. Very good. Let me repeat the question. So, as I was saying, since February 20th, we've received waves of patients. Twice a day they came in dozens. So 10, 15 ambulances with serious cases, or normal cases which became serious in a very short time. So it was a maxi emergency, a very big emergency, but repeated over and over again during the same day. So we had to reorganize our hospital completely and monitor what we were doing every day. So we had to have an exchange with other institutions as well. So we opened up 2 bigger hospitals in Milan, for instance. We began a remote dialogue with the University of Wuhan. We opened communication channels with anyone who wanted to support us and to help us understand what was going on. So Médecins Sans Frontières came also. We had a conference call with a hospital in New York, even before the emergency in the US. And this was a great thing for a small province hospital, because we felt the responsibility of tackling something big, and we decided to do it as best as we could. So with no limits, no barriers, cooperating with everybody, trying to see what we were doing, and monitoring at least twice a day what we were doing. Yes, very complex situation. Let me ask you another question. Now, so today we've introduced several innovative Italian projects and digital projects. Later on we'll also have international projects we'd like to share with you as well, because maybe they can help you and support you in this situation. But I wanted to ask the director, in terms of digital health, so medical and edtech, how far can they help in this situation? Well, they helped us a lot. Several years ago, we decided to invest a lot in digitalization of our healthcare service, and having 4 connected hospitals with digital clinical records, and making it possible for professionals to exchange digitally the information, gave us the opportunity to have new diagnosis opportunities, possibilities, and a collective clinical work, basically. So the choice we made in the past was very useful in the emergency situation. We are using this to monitor what we're doing, basically, because we've got a massive quantity of clinical data we are processing. We're trying to rationalize in order to understand whether we could have done better or what we can do better for the future for this illness that has really struck all the healthcare systems all over the world, not just in Italy. Yes, of course, this is very important. So hopefully we will go on this way. Let me ask you a question, Max. I know you have a very short time. I don't want to take up too much of your time, but at 6 we will have a break, of course, and then we will move on to the other topics. But I wanted to ask you also in terms of digital opportunities. We've seen that fake news, online fake news, are influencing people very much. In your work, digital communication and digital transformation in the healthcare sector, what are the problems you have to take care of? You have to pay attention to values for sure, because a value you have to take into account in digital transformation, like a mantra, is ensuring safety in data sharing, because for sure any solution, beautiful solutions like the ones that were put forward a few minutes ago, need to take this into account. For sure, data need to be kept safe. Private data of citizens and sensitive data need to be protected and be safe. Another thing that is also related with safety is transparency. In this case, we've been listening to Ms. Lombardo talking about interconnected clinical records from different hospitals. So interconnection of data is also very important. We know that there are technologies like distributed ledgers or blockchains. They can actually help in co-managing sensitive data. And last but not least, reliability. Even more so nowadays, because we realize that all applications, technological applications, all data processing, digital data processing, make sense if they are useful. In the healthcare sector, being useful means being very reliable too. Perfect. Thank you very much, Max. Thank you, Ms. Lombardo. Both in terms of communication, but also in terms of technological and digital innovation, we give you full support, of course, as a community. We want to support you constantly in order to improve the situation. Thank you very much for your work and enjoy your evening. Now, we've come to the conclusion of the first part. Let's start the future. We're going to have 15 minutes break. We're going to resume at 6:15 p.m. So a short break for everybody. See you later.
It's time for us to use technology for the good of humanity.